So here again, we are continuing with our fetal anatomy. Can you see here what we have here? That is our stomach, bubble there. Then you can see the umbilical cord nicely there on the fetus, and you can see this is the umbilical artery waveform there, which is very normal. Then that's a very normal low resistance umbilical artery Doppler waveform that we have there. Yes, you can see there. So if you can look here, you can see again. This is where the cord is attaching. That's where the cord is attaching. The fetal cord is attaching there. So let's look at the heart now. Look here at the sinus of Vasava there. It looks like there's a coarctation there. Look at it nicely. If you are not so careful, you can think of a stricture there. Look at it nicely there. See the rest of the aorta there. It looks perfect. If you go there, it looks like there's a stricture. Guys, probe misangulations cause these artifacts, or it can cause these illusions. So if you put color there, you can see that the aorta is filling nicely there. There is no sonographic sign of coarctation. Look at it again. So you feel that there's a coarctation there, which doesn't exist. So look at it again. So look, guys, there's pericardial effusion there. So there's a pericardial effusion. This is physiological, guys, not pathological, but there's a little bit for just for lubrication. Look at these valves. Look here at the root, aortic root there. It looks like there's a coarctation. So if you're not careful, guys, you're going to report a case of a coarctation of the aorta, which in practical does not exist. Look again here. Between the right and the left ventricle, it looks like there's an opening there. It looks like there's a venous shunt there. There's a venous shunt there. But there's no shunting, guys. It's just the probe misangulation. If you change the angle, you're going to see that this line is convex. The septum is very convex. Look again here. So everything looks perfect. Look at the face of the baby. Look at the mouth there that is open. Look at the eyes there, the nose. Look at the nose. Look at the. So that view is very nice, guys. Where you see the nose of the fetus, it's very excellent. You can exclude other pathologies like cleft lip, cleft palate on that view. So I like that view so much. I like that view where you can appreciate. So let's have a look again there. Let's have a look there again. Let's have a look there. And then you can see what is going on again. So the idea is for us to beat illusions as much as you can. If you want to be a good practitioner, please, you must beat the illusions. Take your time, scan in multiple planes. Understanding that there can be pitfalls can also help you to overcome them. Most of the reports, about 60 to 70% of people that are doing fetal echocardiography, what they are writing are illusions. It's not only confined or isolated to fetal echocardiography. In ultrasound in general, so most of the things, if you look here again, it will appear like there's an opening. You see here, at the apex of the heart, it looks like there's an opening. If you don't look closely, it looks like there's an opening. But you can see that this blood is not spilling into the pericardium space there. Look at here, when the heart is pumping. So it looks like there's an opening which doesn't exist. Ladies and gentlemen, the problem of fetal echocardiography is you are dealing with two moving targets. So the fetus itself is a moving target, and also the heart is a moving target. So you are dealing with two moving targets at the same time. So you ideally have to examine, knowing it very well that these things are moving. The fetus might not be stagnant, but you must be able to see anatomy nicely, because those who did physics, they know the relative motion, the principle of relativity. So when two structures are in motion, it can also create artifacts. So you can see the nice 4-chamber view there, very nice. So again, what I was talking about, look at the eyes, look at the mouth, the nose, the upper lip, the lower lip. This is a great capture, guys. This is the uterine artery Doppler there, and that's the heart rate of the baby or the fetus. So, ladies and gentlemen, what I need you to do is to master ultrasound gradually. You must know the do's and the don'ts of ultrasound. If you know the do's and don'ts, it means your practice will be filled with honey and gold. You will enjoy. But if you don't follow the rules and the protocols, and if you are not informed, you are going to fall into traps and pitfalls. So
hello, everybody, and welcome. In today's video, I'm going to be showing you how to do an introduction from start to finish. This is Nurse Eunice, the owner of Florida Training Academy, and let's get started. Helpful hints. Number one, always knock on the door before entering the room. Number two, wash your hands before touching the resident. And number three, provide privacy by closing the door or curtain. Come in.
It looks like this fluid is
Hi, Mr. Lucas. Good morning. My name is Eunice. I'm your CNA today, and I'm here to take your pulse. Is that okay?
Illusions.
All right, before I begin, let me go wash my hands and provide some privacy.
The baby's moving. Look here, you see? The baby's moving. There's motion there. That's the liver.
Washing my hands.
There's motion. You can see there's motion there, and there's also motion on the heart. So relative motion.
And now that my hands are clean, I'm going to remove this call bell. How are you doing today?
Relative motion. So.
Oh, that's great to hear.
Be informed and understand anatomy. The other thing, you see, the liver there and the heart there. So you have to understand.
It's time for your vital signs to be taken. Is it okay if I start now?
If they are.
Count the radial pulse for 1 full minute. If during your test you lose count, ask your nurse if you can start over. Don't forget, practice makes perfect. Practice on your family members, friends, and patients if you currently work in healthcare. So after taking the patient's pulse, make sure you document. And if you need to watch a video on how to take the pulse, I have a video for you. Just look in the description area. So now that the vital signs are finished, I have to end my skill. And you want to end your skill with safety in mind. So anything that you have undone, you need to go back and redo. For example, if you lower the rail, make sure you raise it back up. If you raise the bed up to a working height, make sure you lower it. And in my case, the only safety concern I have right now is giving my patient the call bell and making sure that he doesn't need anything else. So here we go.
That are so confusing at times.
I have your pulse and it was 78. All of your vital signs are fine. Do you have any questions for me right now? Do you need anything? Well, here's your call bell. Press the button if you do need me, and I'll see you on my next rounds.
This patient presented to
I'm going to open the curtain.
With the lower abdominal pain lab, and the referring clinician was suspecting.
I'm going to wash my hands again.
So
don't forget to document your findings. And guess what, everybody? It's that easy. That was an introduction and an exit with Nurse Eunice. See you in the next video.
See here what we have there. That's our gestational sac, and then you can see the cyst is there.
All right, so before you begin any patient care, you want to sanitize your hands. A napkin is not required when you are initially starting, but I like to use a napkin and turn my water on and to turn my water off. So you want a mixture of hot and cold water. You want to make sure your water is nice and warm. So let's test the water temperature. It feels good. I'm going to wet both of my hands. If you feel that your jacket is going to become an issue, you can take it off before you begin your skill, or you can roll up your sleeves. So now that my hand is wet, I'm going to apply some soap. Keep your hands lower than the elbow, ensuring that your hands do not hit the inside of the sink. If they do hit the inside of the sink, let your instructor, your evaluator, know that you've made a mistake, and she will let you know if you can continue from the mistake or start all over again. So I'm going to clean the palms, the back of an hand, the back of the opposite hand, in between the fingers, in between the thumbs, around the wrist, around the opposite wrist, and I'm going to go up and down every finger. According to current CDC standards, friction should occur for at least 20 seconds. So if you feel that you did not reach 20 seconds, go back and clean more. After my 20 seconds of friction, then I want to proceed to my cuticles and nails. You're literally going to clean around the cuticle and then clean under your nail. You're going to clean around and under every nail. If your nails are extremely short, you still have to clean beneath them. You just don't want to hurt yourself. So you would just do a simple scrape But here I'm literally cleaning beneath my nail as if I'm trying to remove some dirt or debris. If you have long fingernails because you did not cut your fingernails down before your test, you would be scraping them across your palm. But remember, in most facilities, fake nails or acrylic on top of your nails are not allowed. You're now going to rinse the water, rinse the soap off of your hand utilizing the water, remove all soap suds, and once all the soap has been removed, use a napkin to turn the water off. Do not compress this napkin because if you do, you're going to contaminate your clean hand with the dirty napkin. It's the part that just touched the faucet handle. Discard the napkin. Whenever you are drying,
without ultrasound,
hold your hand lower than your elbow and pat dry. If you do the opposite, water can run down your arm. If you need more than one napkin, by all means get another. Just make sure that your hands are totally dry before you begin providing care. And so everybody, that is it. That is hand washing for the CNA examination. If you like the video, give it a thumbs up. I hope that you subscribe. And we have a whole video playlist with CNA skills and caregiver skills videos. So we hope to see you in our next video.
We also have to look at gynecological structures.
Hey team, welcome back. It's Nurse Eunice, and in this video, I'm going to show you how to put on and take off your gloves. Yes, remember as a CNA, you cannot perform sterile technique. You're not a patient care tech. You're not a hospital level CNA. So you perform clean technique only, which means that you just use the traditional gloves that will be located within your patient rooms. Just take them out of the box. You have to wash your hands first. We don't want to be contaminating these gloves because if your hands are dirty, that means that these gloves will be dirty also. So wash your hands before and after removing your gloves. And let's get started. So I have clean hands, and now I'm going to apply my gloves. These are nitrile gloves. I want you to be mindful of any skin allergies you may have. So if you're allergic to latex, just make sure you read. And then also, my future CNAs, make sure that when you're restocking, when you're replacing the gloves, that you replace them for every person that you work with. So just don't replace the medium-sized gloves. If there's a size that's missing, be mindful and replace those too. All right, so let's get started. I'm going to put on my gloves. I have clean hands. I'm going to find the thumb of the glove. So there's the thumb. I'm going to put the first glove on.
Is the sonographic sign of uterine diadems? So those things,
glove is on.
You must pay due diligence.
Let's repeat that process on the other side. I usually start by putting the glove on my dominant hand first. Is that a requirement? No, it's just something. It's a good technique, but it's not a requirement.
They say that
so now that I have the gloves on, we call that donning. Now that my gloves are on, I want to show you how you should hold your hands once your gloves are contaminated. Never bring the gloves towards your body. Always keep them out and away. If there's a contaminant, if there are some fluids, it's okay for you to have them fall onto the floor because you can always go back and clean the floor. What you can't do is have it fall onto your uniform. And so you want to stay as clean as possible, especially when you're working a 12-hour shift and you have so many patients who need you to remain clean to take care of them. So now that I have soiled or contaminated gloves, I'm going to start removing them, not at the very edge. If you try to do so at the very edge, you're going to contaminate your skin. So about an inch below the cuff of the glove, I'm going to pinch and pull off. So now this clean hand cannot touch the outside of this glove. If we do, this hand becomes contaminated. So what we're going to do instead is you can take one or two fingers, you're going to go under the glove, you're going to pull it off, and then you're going to discard of it into the appropriate waste receptacle. Why do I say that? Because if it has blood on it, it's going to go into the biohazardous waste. But if it's just regular tissue paper or something, it can go into the trash. So let me dispose of this, and I'm going to have you teach me how to perform the skills next. So go ahead and get your gloves, and we'll get started shortly.
18 weeks to 23 weeks during that period.
All right, team, I'm back, and I have my clean gloves. Doesn't matter which glove I put on first. Should I start with my dominant hand or my non-dominant? What do you think?
I need you to.
If you said dominant, you're right. Let's go ahead and put that glove on.
It is done.
find the thumb,
so
glide
if you
it
look
on.
Here, you can see here.
All right, so glove number 1 is on.
So
Let's go ahead and glove the second hand.
So this is the genitalia. So we can determine the gender at this stage.
Remember, these are not sterile gloves. These are clean gloves, and you can put them on after you've washed your hands. All right, so now we're going to pretend as if the gloves are contaminated. How do I remove my glove? Do I start from up here first? Is this correct? That's right. That would be incorrect. So hands pointed downward, you're going to pinch, and pull off.
So
contain the removed glove. Now, can I touch the outside of this glove? I cannot, but I can take 2 fingers. I can go beneath. I can remove the glove. Don't touch the inside, but you can touch the outside. And you're going to take this and you're going to put it in the appropriate waste receptacle.
You can see the foot there and the toes nicely there.
Now, what do you do with your hands?
Demonstrated there.
If you said wash your hands, you're absolutely right. Look, you all, I'm so proud of you. You just learned how to don or put on and doff or take off your gloves. And I look forward to seeing you in the next video. Bye. Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com.
Now we are checking the
All right, so let's talk about how to take a pulse. And so there are different points throughout the body where you can actually feel someone's pulse or pulsation. And so every time the heart beats, contracts, blood circulates, and at different points throughout the body, you're going to be able to feel a pulse.
The normal pulse or heart rate for an adult is 60 up to 100 beats per minute. If the heart rate is greater than 100 beats per minute, that is called tachycardia. If it is less than 60 beats per minute, that is bradycardia. You would notify your nurse of any abnormals or if your patient has any additional concerns.
And for CNAs, the pulse that we feel will be the radial pulse. So everyone say it with me, radial. If you come up to your patient and your patient's talking to you and they're responding, do not go for their carotid pulse. Carotid pulses are for emergencies only. And so to locate the radial pulse, Mrs. Loretta, is it okay if I hold your hand?
Yes, ma'am.
And I'm going to take this cowbell out the way because we won't be using it right now. The radial pulse is located in the wrist area at the base of the thumb. And whenever you're taking a pulse, I want you to remember that you shouldn't be wearing gloves unless your patient's in isolation. So for your CNA examination, of course, you wash your hands, you do your introduction, but no gloves because gloves decrease the sensation and you'll be less likely to get an accurate reading. Also, you cannot take a pulse with your thumb because if you do, you'll actually be feeling your own heart rate. You'll be feeling your own pulsations. So the way that I do it is 3 fingers. And so research has indicated you can take a pulse with 2 or 3 fingers. Both Loretta and I have worked on cardiovascular units with patients who may have irregular heartbeats, etc. So for me, I've always used 3 fingers, but you use what's best for you. 2 or 3 fingers are allowed. Think about circulation. If I raise this wrist up, this arm up, the blood flow is going to decrease. So whenever you're taking someone's pulse, keep the wrist down. Put 2 or 3 fingers on the pulse. We have a clock over here that I'll be using. At your test sites, if allowed, you can wear a watch, but usually you and your nurse will be on one side, you'll be on the other side, and so your nurse evaluator will be counting the pulse at the same time you would. And so you and your nurse, can I please get you to stay on the other side, please? Right here on this other side, yes. And so would you please gather her wrist? You're going to get a wrist. Right, and so we're going to be looking at the clock that's over there. Right, and so you're going to put 2 fingers here. And do you feel those pulsations?
Look here, you can see.
Yes. All right, and so I'm going to tell you when to start, okay? All right, so let's go ahead and start now on the 12th. We can start.
So let's look at the heart now. Look here at the sinus of Vasava there. It looks like there's a coarctation there. Look at it nicely.
Great job. And so at your test site, you would never know your nurse's number. The count that I received was 78. What number did you count? 78 is very good, very good. So at your test site, you can be 4 away from your nurse's reading. And you have to count the pulse for 1 full minute. So I know what they do in the real world. You'll count for 15 seconds and multiply the number by 4, or maybe 30 seconds and multiply by 2. But when you're testing to become a CNA, you want to do it for the full minute. And if you lose count, or if you feel that you have maybe the pulse isn't as strong in one wrist as it would be in the other, you can tell your nurse that, hey, I need to start over, or may I start over? You can also ask your nurse if you can switch extremities. And so don't forget to document your findings. For your state of Florida CNA exam, usually the pulse is by itself. In the real world, we can do pulse and respirations, but for the test, you have to do a whole introduction, take the pulse, document the pulse, in your skill by giving the patient a call bill, making sure the bed is back low, etc. Don't forget to wash your hands if I didn't say that. And then if you have to do respirations, you have to knock on the door and start that process all over again. So I just did the pulse skill. I would make sure I tidied up everything that I documented. I washed my hands and I opened that curtain at the end. I would give the patient back their call bill, ask if they have any questions, and then I would be done with this skill. I would then have to knock on the door, come back again in order to do respiration. So that's what we do for the Florida CNA examination. If it's different in your state, please let us know. Again, this is Eunice and this is Loretta. And we are here at Florida Training Academy, so we look forward to seeing you in the next video, which will be about respirations. All right.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
So let's talk about respirations. And so whenever you're counting a patient's respirations, you're actually letting your nurse know how well this patient's breathing. And so a normal respiration rate for an adult is 12 to 20 breaths per minute. And so a breath would be 1 inhalation. We're actually breathing in oxygen, and then 1 exhalation. So in and out. Breathe in oxygen, let out CO2. And that would be the full process. So as far as your patient's concerned, whenever a patient takes a deep breath in, and then they release it, that process would be 1 breath. In, out, 1. So if your patient's respiration rate is lower than 12, maybe you can stimulate them, try to wake them up a little bit, but don't be afraid to notify your nurse. Get your nurse in the room, because whenever we're giving pain medications or sedatives will relax your patients, but it also causes them not to breathe as effectively. And then if a patient's anxious, maybe they're having an anxiety attack, or if they're having a lot of pain, their respirations may increase. So remember, 12 to 20 is the normal range. Anything outside of that, let your nurse be made aware. And so now we're going to focus on Mrs. Loretta's respiration rate. Whenever you take your test, don't forget you do the whole introduction first, and then after your introduction, which includes hand washing, you can tell your patient to relax. If you're having difficulty with seeing your patient's chest rise and fall and they are laying flat, you can sit them up. Opposite, if they're sitting up and you can't see the chest rise and fall, or the stomach rise and fall, you can lay them flat. But play with the position as you need to in order to make sure that you get an accurate respiration rate. And then one more thing that I want to discuss is that you cannot let your patient know that you are going to be counting their respiration. So what we say instead is a blanket term. My name is Eunice, I'm your CNA today, and I'm here to take your vital signs. Is that okay? Yes, ma'am. So you want to keep the element of surprise, because if you tell them that you're going to count their respirations, they stop breathing on you. They're like looking at you, looking at them. So I'm going to go ahead and begin Ms. Loretta's vital signs, aka respiration, shortly. All right, so Ms. Loretta, is it okay if I hold your wrist? Yes. And I'm holding her wrist to keep the element of surprise. I'm not holding her wrist because I'm actually taking the pulse. Instead, for the next 60 seconds, I'm going to look at her chest rise and fall. And I know what you do in the real world. You lie about the respiration. Stop lying. Everyone's respiration rate isn't 14. Stop documenting that. We can check the chart history and see that you're not telling the truth. So really count your patient's respirations, because again, if it's too low or it's too high, you could be the person that helps protect your patient from maybe receiving too much medications. And so now we're going to focus on the chest rise. All right, pretend that I'm still holding the wrist. For video purposes, I'm going to be counting with you.
And we're going to start
there's no
now.
omphalocele, which is excellent. But you look
One.
at here. Look, it looks like there's a big opening there at the apex of the heart. It looks like this fluid is coming
Two.
from there, from the heart itself. Looks like blood is leaking into the pericardial space. These
Three.
are illusions. If you look closely here, look here.
Four.
The baby's moving. You look here. You see, the baby's moving. There's motion there. That's the liver of the fetus there.
15.
There's motion. You can see there's motion.
And
there's also motion
16.
So relative motion.
All right, and so now that you've actually taken respirations, of course, you can give your patient back the call bell. Don't forget to document your findings, wash your hands, and
be informed.
Open up the curtain if you had closed it.
Ms. Jenkins, I'm here to do your pulse and respiration. So I've already washed my hands and I've closed the door for privacy.
Okay.
If they transposed the organs, so the heart is on the left side, and then the liver on the right. So,
And I'm going to begin now.
Ladies and gentlemen, look at the four-chamber view. Look at my four-chamber view. But here, that's where the problem is. Like it feels like there are openings in the heart which literally don't exist. I thank you, ladies and gentlemen, for your time. Don't forget to share this.
Count the pulse for 1 full minute.
Also subscribe to our channel. Leave a like and comment.
Then watch the resident's chest rise and fall for another full minute.
In unholy matrimony, a marriage between obstetrics and the gynecological structures, and they can create a lot of problems. So in this presentation,
one exhalation and one inhalation equals one breath.
Obstetrical challenges that are so confusing at times and misleading.
Okay, done. I've finished your pulse and respirations. I'm going to go document now. You have your call bell. Anything else I can do for you? Nothing. All right. Thank you very much. Wash your hands and document.
Presented to the department with the lower abdominal pain lab and the referring clinician.
So this is an illustration of the gauge on a sphygmomanometer or blood pressure cuff. Because it's going to be harder to read on the actual cuff itself, we're going to use this drawing or this illustration over here to show you how to read the gauges so that you get your numbers accurate when you're taking someone's blood pressure. And the blood pressure is a measurement of the pressure of the blood flowing against the walls of the arteries. The arterial blood pressure is constantly changing during the course of the cardiac cycle. The highest pressure in the cycle is called the systolic blood pressure. That's the top number. The lowest is the diastolic blood pressure. That's the bottom number. Both readings are necessary to enable you to evaluate the status of your patient's blood pressure. And so in order for you to accurately obtain a blood pressure reading, you have to be able to read this gauge. If your gauge is calibrated, so I'm always going to start off here with says mmHg, that's millimeters of mercury. That's how much pressure. And so we increase the pressure by actually squeezing on the bulb, and I'll show you that in a few moments. And so our machine is calibrated, is directly in the center at the bottom, which represents 0.
Make sure that you also
here we have a dark line, a long dark line, followed by 4 short lines, another long dark line, followed by 4 short lines, and then another dark line. This is how it reads. Everything's in increments of 2. You cannot get an odd number when you're taking a manual blood pressure. If you're using an automated blood pressure cuff, then sometimes an odd number will be seen. But if you're using an earpiece, a stethoscope, and a manual blood pressure cuff or a sphygmomanometer, you should not obtain odd readings. So here we go. 20. Small line above would be 22. 2 small lines above 20, 24. 26, 28, long line with no number would be
check if there are no other masses,
30.
no other obstacles.
Let's keep it going.
The uterus
32, 34, 36, 38, 40.
Make sure that
And so now I want you to pretend as if we are inflating the bulb. We're pumping. Our patient told us that their systolic blood pressure is normally 120, so we're just going to take it 30 above to 150. Now that's the cheat way. When you're in nursing school, they may teach you a little bit differently, but I'm going to show you the quickest way possible so that you'll learn fast, and then you can add those extra techniques when you're in nursing school. So you would actually inflate the pump to 150, and then you start. Right, so we're going to pump the cuff up to 150, and then we're going to gradually release the air valve. We're going to turn it counterclockwise. We're going to turn it back towards us. And the needle should drop about 2 millimeters of mercury per second. And so where you hear the first thump is going to be called the systolic pressure. And so here it is. Let's say we heard our first thump here. You're going to continue to release the air slowly, and wherever you hear the last thump and it gets really light, that would be our diastolic pressure.
You must check those gynecological structures.
You remember where you actually heard your sounds. One line below this dark line would represent 128.
Around the uterus for,
and then one small line above this line. If this was 60, this would have to be 70. That would make it 72. So if you were writing this blood pressure down, you chart it as the blood pressure being 128 over 72. Now let's put it all together. We know how to read the gauge. Whenever we're practicing, I always ask that you practice without an arm in the cuff until you know what you're doing. And so I know your family members want to help you, but actually just have the cuff wrapped on itself. We talked about this bulb. We have the air valve here. We're going to tighten the air valve by turning it away from us, but don't tighten it so tightly to where you can't open it with 2 fingers. So you're going to close it. You'll know when it's closed because you won't be able to turn it any further. But again, don't make it so tight until you can't open it up with your 2 fingers. I like to keep 2 fingers on the air valve at all times. But here we go. We have it closed. And now we're going to start inflating.
So it is good.
And remember, when you're just starting off, my recommendation is that you don't use anyone's arm because you need to learn how to control this gauge. All right, so the needle's dropping a little bit. What I'm going to do is I just closed it tightly to stop it just for classroom purposes so I can show you what to do. I'm going to put 2 fingers on the air valve and I'm going to slowly move it towards me. I'm turning it very slowly and I'm letting the air release from the blood pressure cuff about 2 millimeters of mercury per second. And remember, if you are using your stethoscope, where you'd hear your first thump or your quarter cuff sound would be the systolic blood pressure. Where you hear the last quarter cuff sound would be the diastolic blood pressure. And once you hear no more sounds, you release all of the air from your blood pressure cuff. Let's practice once more. What do I need to do to my air valve? I'm going to turn it away. I'm going to close it, but not make it so tight until I can't open it with my 2 fingers. Once it's closed, you can do the 2-step method where you feel the radial pulse until it no longer, and inflate the cuff until you no longer feel any pulsations, and you can go 30 above that number, or you can just do the easy way I'm going to show you. Just inflate the cuff to about 150 if it's someone who does not have a history of hypertension. If they have a history of hypertension, you may have to go to 180 or 200. So here we go.
Then we see how
and in nursing school, they'll teach you a different way. Right now, I'm just teaching you how to control your needle, release your air.
The pen is there. So this is a male. You can see the male genitalia there. So this is the.
And if you can control this needle, you can slow it down. You can speed it up. And remember, when you don't hear anything else,
When you hear your last thump, you release all of the air out of the blood pressure cuff, and then you remove it, take it off of your patient's arm. So this was our practice without a patient. In the next video, I'm going to show you how to actually take a blood pressure and use a stethoscope.
So that's the heart there. That's the heart. This is the heart of the baby.
Hello, everybody, and welcome. My name is Nurse Eunice, and in today's video, I'm going to be showing you how to perform a manual blood pressure. And I have my wonderful assistant, Anijah. She's going to be in a couple of our videos. So one of the first things you want to do is, of course, hand hygiene. You want to perform that first. So over here, I do have hand sanitizer on our station. We also have our blood pressure cuff, which is also called a sphygmomanometer. And then we have our stethoscope. If you're going to be using your equipment for multiple patients, you want to also ensure that you have alcohol swabs so that you can be cleaning the earpieces and the diaphragm of your stethoscope before you use it on a different patient. And if you're using your blood pressure cuff on multiple patients, you want to make sure you also have wipes so that you can be cleaning your equipment and sanitizing it. We don't want you putting dirty equipment back in your care. One thing I always like to do is to ask, is it okay if I take the blood pressure on a particular arm? So Anijah, can I use your left arm? Yes. Awesome. All right, so we're going to go ahead and we're going to place the blood pressure cuff or the sphygmomanometer. I do have another video in which I'll be showing you how to read the device. So if you've never read a blood pressure cuff before or a sphygmomanometer, just check in the description area for a separate video link.
That's the heart that we have there. So that's the spine. You can see that the spine is okay. There are no.
All right, so prior to placing the cuff, we actually have Anijah's arm on the flat surface. And so she's sitting upright. We have her arm at the level of the heart. We're going to go ahead and bring the sleeve up.
And the ends are coming there. You can see how it is moving.
When you're applying your cuff, it has artery indicators. It has arrows on the actual cuff. And what the arrows indicate, I'm going to have your palm up for me, is this is left arm and it's pointing to the brachial artery. And so whenever you all are in nursing school and you're in programs and you don't place your stethoscope properly, I know because, number one, there's an artery indicator, which lets me know that the brachial artery is going to be on the inner aspect of the left arm, and that's also the location or the place where you be putting your stethoscope. So, knowing your positions of your brachial artery, and remember, if you can see it, it's not an artery. If you can see it, it's a vein. Whenever you're doing your cuff placement, you don't want the cuff too high, you don't want it too low. This is the antecubital area. You want to make sure it's at least 2 finger breadths above the antecubital area so that you have enough room for your stethoscope. And then you're going to apply the cuff. Now, as far as your stethoscope is concerned, whenever you're placing the earpieces in your ear,
this is the cerebellum, and
you want to test your equipment. You're going to tap on the diaphragm of the stethoscope. This is the diaphragm, which is used for adults, and this is the bale that's usually used for pediatric patients. You want to tap on the diaphragm, and if it doesn't make you jump, chances are your stethoscope's not on. Some of your stethoscopes will turn. Ooh, you want to turn it until it's in the on position. And now we're going to place the diaphragm of the stethoscope on top of the brachial artery.
You can visualize the legs again. You can see they are straight.
And I'm just going to reposition this a little bit so I can see it. Make sure your tubing is not hitting the stethoscope. So I'm going to move this over. So now that we're ready to place our stethoscope, we're going to place it on top of the brachial artery, like so.
That's the fetal stomach.
When you're holding your stethoscope, try to keep your hands off of the tubing. Otherwise, you're going to have additional background sounds. So we have the brachial artery here. Right? And so this is where we're going to place the stethoscope.
Like we're cutting it.
Whenever you are going to be inflating your stethoscope, you have to turn your valve. And remember that righty, tighty, lefty, loosey. So if you want to tighten this up, you turn it towards the patient. If you want to release the air, you turn it away from the patient.
So that's the heart.
All right, we're going to inflate it to about 160. So here we go. You'll see the needle moving.
The thalami. In the cavum septum, pellucidum there, the thalami, the cavum septum.
So we're at 160. I'm going to turn it slowly towards me.
To measure the biparietal diameter in our head circumference for the baby. So we use those landmarks. So you can see that the brains are nice. There is no...
And you'll be making note of the first heart tone or cortical sound that you hear, and also the last. The first heart tone would be known as the systolic, and the last would be the diastolic. And I'm just going to repeat that again so that you understand it. We've located our brachial artery. We're going to place the stethoscope on top of the brachial artery. We're going to turn this away, making it tight.
Those are the legs.
I'm going to inflate the cuff to 160. You go up to as high as 200, depending on the history of your patient. If they have a history of hypertension, you go a little bit higher. You're going to slowly deflate.
Excited there.
And note where you hear your first cortical sound and your last cortical sound.
I want you to keep practicing taking the manual blood pressure. And remember that practice makes perfect. If your patient has a history of hypertension, you would start your blood pressure cuff. You would go ahead and inflate it so that the needle is about 40 above their last known reading or their highest reading. For example, if the person's last systolic blood pressure is 160, it would be okay for you to inflate the cuff to 200. If you lose count, if you're not sure, let all the air out of the sphygmomanometer or the blood pressure cuff and start the process over again. We're usually only allowed 2 opportunities to take a blood pressure on each extremity. So if you attempt the blood pressure twice on the left arm and you're unsure of your reading, you would then have to go to the alternate arm. If you keep squeezing, if you keep applying pressure, there's going to be less circulation. It's also going to be increased pain, both of which would negatively impact the blood pressure reading. And so if you want to purchase your own blood pressure kit, I got this one off of Amazon for less than $25. If you're not a fan of the loud, bright colors, of course they have blue, they have black, they have red, they have purple. So I'm going to have a link in the description area below.
And there are 5. So you see them again, see them again, you see them again.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
Those are the lip. That's the upper lip.
Hey everybody, welcome back. This is Nurse Eunice, and in this video, we're going to be showing you how to weigh a patient. And so whenever you think about weighing a patient, although this may not be on your state's examination, you still have to know how to perform the skill, because some of your patients require daily weights. And that'll usually be a patient who is maybe malnourished, they're not eating enough. It could be somebody who has congestive heart failure, or they're at risk of retaining fluids. It could be somebody who's on dialysis, well, because their kidneys aren't working, they're not excreting the excess fluids, they could retain the fluids, and that too could back up into the heart and the lungs. So whenever your nurse asks you to perform a daily weight, at least now you will know why you're doing it. Another thing I want to discuss before we start the skill is to make sure that you do your weights first thing in the morning before your patient has eaten, and also make sure they use the bathroom. If you have a balance beam scale, you'll have to go ahead and zero it. We have an electronic scale, and that's what we're going to be using today during our demonstration. And we're going to get started now. With every skill, you're going to knock on the door before entering the room, and then you're going to greet the resident. Hello, Mr. Mitchell. My name is Eunice. I'm your CNA today, and I'm here to weigh you. Is that okay?
Yes,
All right, before I begin, let me go wash my hands. I'll be right back. Don't forget to wash your hands. For the CNA exam, you'll be washing your hands before and after the skill, and also provide privacy. So what have I done so far? I've knocked, I've introduced myself, I've greeted the resident, I've explained the procedure, I've gotten their permission, and then I've washed my hands, and I've also provided privacy by closing the curtain. And now let's get our patient up. Let's get them sitting upright. Right. And so, are you able to sit up? Can I assist you?
Yes. This is the other one. You can see
now let's break your legs over, okay?
It crosses the external leg.
And before we stand you up, let's get you to scoot just a little bit. I want to make sure your feet are flat on the floor. And before we get you up, how do you feel?
Fine.
All right, no dizziness?
No, ma'am.
All right. And even though I didn't say it before, Mr. Mitchell has non-skid socks on. And so if your resident or your patient did not have the non-skid socks, you would then put their shoes on. But this is going to be best for the weighing scale because it doesn't add as much weight.
and the expected delivery.
All right, so on the count we're going to stand, okay? 1, 2, and 3.
So these are the
You're still feeling okay?
Yes, ma'am.
And so we have an electronic scale here. I'm going to help you on the scale, and then we're just going to put my arms around you once you're on the scale, just in case you lose your balance, okay? All right, let's go ahead and get you to step on.
No abnormalities. Thank you so much. So we now have
Thank you so much, Mr. Mitchell. Let's get you to step off, please.
Call the pregnancy library.
Right. So if I can get you can either step back, you can turn towards the bed. Okay. Great job. Do you need help getting your legs back in the bed?
No, ma'am.
Okay, all right.
Thank you so much.
And here's your call bill, Mr. Mitchell. Is there anything else I can help you with?
No, thank you.
All right, I'll see you in a few moments, okay?
Thank you.
So now that we've finished the scale, I want you to pick up your scale. If your facility requires that you clean it off, by all means do so. But don't forget to document. That's right. But I want you all to document for me. In the United States, we document in pounds. However, if your facility requires that you document in kilograms, you'll do so by dividing the number of pounds by 2.2. So whatever the number of pounds were divided by 2.2, and that would give you the weight in kilograms. But you must document after you perform the weight. Don't forget to go wash your hands, open up that curtain, and then just to look back. Make sure that the bed is in the lowest position, that your patient or resident has their call bell. One last thing I want to add. In the state of Florida, if you're taking a CNA examination, the side rails are optional. So if the side rails are there, you're welcome to raise the rails. However, if they were lowered when you came in, you can also perform the skill and keep them lowered. The goal is for you to be able to provide care and provide care safely. So you're not passed nor failed on the absence or presence of the side rails. You are judged on how you provide the care and whether you can do so safely. So I hope you learned a lot from this video. Remember, we have to do those weights. It helps to monitor the health of our patients. And I'll see you in the next video.
Hello, I'm Nurse and the owner of Florida Training Academy. In today's video, I'm going to be showing you how to brush the teeth of someone who is in the bed. I have all of my supplies here, which will include a towel that we'll use as a clothing protector. I have the toothpaste and toothbrush. Of course, I have clean hands with gloves on them. I have the emesis basin, a cup of water, and I'm going to go ahead and start the skill. You want to be mindful of safety. And so in order to prevent our patient from aspirating, what position do we need to put our patient in before we put water in his or her mouth? And if you said upright, 90 degrees, that's perfectly correct. The Fowler's position can go from 60 degrees all the way up to 90. I just feel more comfortable raising my patient up as far as they can tolerate. So I'm going to go ahead and raise our patient. Are you doing okay today?
The image, so that you can have an appreciation of the chambers, the greater vessels, and then the outlets.
If you feel like you need to reposition, you can go ahead and do so.
So you must make sure that you put everything into picture, so that you don't miss any abnormalities.
I'm going to put a towel over your chest.
So the other thing, you must make sure that the heart is within the chest. You see, this is the abdomen there, this is the diaphragm there, that's the stomach bubble. So you see that our heart is localized within the chest, and the IVC, that's the inferior.
Would you like a sip of water before we start?
You can have a heart that would be at an ectopic site, what we call an ectopia cordis. So do not just scan.
I'm going to wet the bristles of the brush.
Anatomy.
Apply a small amount of toothpaste.
Formulas one of the fundamental skills.
And this one is mint. Are you okay with mint?
To acquire when you want to be a competent sonographer or someone who can.
And now we're going to perform the skill.
Be confident in your practice.
And with my clean gloves, I'm going to go ahead and open up your mouth. Right, we're going to start off with the.
Is how you can zoom your heart nicely and check all the chambers.
I'm going to go inside.
Remember,
I'm going to repeat that process up top.
It's not easy because we are looking at two moving targets that you have to beat.
And now that I've brushed all, you go ahead and clench your teeth together for me.
So you must be very vigilant.
All right. So now that I've brushed all the surfaces, if you'll stick out your tongue,
very meticulous, so that you
don't brush your tongue.
Miss.
I'm going to now give you some water so that you can gargle.
The heart. Also, during that time when I check in the heart, you also have to check the lungs or the fetal chest to see if there
we'll let you rinse one more time, and I'll make sure I clean your beard.
So this is a continuation of part of the fetal anatomy or anomaly assessment that
very good.
I was talking about.
Clean your mouth and your beard.
You must be very careful because it is very easy to miss. I also do miss.
So now that I'm done with the brushing of the teeth, I'm going to throw away my disposable supplies.
Abnormalities. Some of them, they are too silent.
After emptying the contents of my emesis basin into the toilet, I would have to use a napkin in order to turn the water on because my gloved hands cannot contaminate the sink or the faucet handles. So I would rinse, pour out my rinse water, and then I would dry the inside of the emesis basin. Of course, I would store whatever supplies I have left. Don't forget to take off your gloves, wash your hands, reposition your patient, put that side rail back up, and make sure that he has his call bell in his hand before you leave. And then also remove the protective covering.
Is making sense.
All right, everybody. This is Eunice Baptist with Florida Training Academy. We wish you the best of luck with your future CNA examination, and we hope that this skill will help you to pass your test and also provide better care for your residents. Hello, everybody, and welcome back. This is Nurse Eunice with Florida Training Academy, and in this video, we're going to be showing you how to clean dentures. We know that dentures are extremely expensive, and so you want to make sure your dentures are in a case. For the state of Florida exam, don't forget that denture care is a two-part skill. After cleaning the dentures, using a denture brush and the denture paste, which don't have toothpaste, you have to go back and provide mouth care. And when you're providing mouth care, you're pretending like your partner does not have any teeth. Remember, it's just a test. Even if someone did have real dentures, they're not going to take them out just so you can pass your test. So since you're pretending that your patient doesn't have any teeth, instead of using a toothbrush to cleanse their mouth, you're going to use that toothset or swab. And I will make sure that I have an image so that you can actually see what that looks like if you've never seen one before. But let's focus on first things first. Let's focus on denture care. All right, so I'm going to go ahead and open up the cap.
On the internet gather here.
Place my dentures
I'm going to show you
on the countertop.
how
I'm going to put a washcloth in the base of the sink. We know that when dentures come out of someone's mouth, they're really slippery. And so we don't want them to hit the porcelain, the inside of the sink, and be damaged. I'm also going to start running some cold water. We only want to use cool or cold running water on our dentures. We don't want the water too hot because real dentures could be affected or reshaped by the hot temperatures. I'm going to go ahead and wet the bristles of my denture brush. As a test site, they may have you using toothpaste, but in the real world, we use denture paste on dentures because toothpaste would cause abrasions that would allow germs to grow on the denture and cause the dentures to have an odor. So test site, you use what they have. Real world, use denture paste on dentures. I'm going to rinse off the dentures. Remember, for this scenario, the person just removed the dentures from their mouth and they're preparing for bed. I'm going to brush all surfaces of the dentures.
The feet.
This angular portion, let's say there was some adhesive or something in the denture, I can remove that, or some food particles. I can use the angle portion for that.
So now you can see, look at the feet also.
Make sure you hold the denture securely, and when you're done, there should be paste all over your denture. You can now rinse.
I did this case today, and you can see the foot there.
Make sure you also rinse your denture.
The bones of the foot nicely there. You can see the heart there. You can see the arc of the
when you store the dentures in a cup, especially if you have the upper and the lowers, think about the orientation, how they go in the mouth, and that's how you want to put them in the cup too. So since these are the upper dentures, we're going to put them in the cup with the teeth down and the gums up.
Gender determination is one of the key things.
And now, so the dentures don't dry out, I'm going to put water into the cup.
Very exciting.
So that the dentures are actually beneath the water. That's going to make sure the dentures are comfortable for your patient. At the test site, your nurse might tell you to pour the water out. Do whatever he or she tells you to do.
Acquisition, the brightest mode. So you can see the turtle sign there.
I can now turn off the water.
Turtle sign. That's the turtle sign there.
Remove my washcloth.
Yes, the penis. And
I'm going to go ahead and take this washcloth to the laundry basket.
The sec is there. So you can see this gender is very much well
I can now take my denture supplies back into the clinical room, open up the cabinet and store them. And don't forget, denture care is a two-part skill. After performing denture care, you have to perform the resident's mouth care. All right, everybody, again, this is Nurse Eunice with Florida Training Academy. I hope you liked our videos. Go ahead and like and subscribe. Share our videos with a friend. And if you know anybody who's interested in being a CNA or a nurse, this is a great place to start. Plus, you get to do so for free. All right, everybody, have a blessed day. Bye.
You must make sure that you do your homework.
In this video, I'm going to be showing you how to feed a resident. And don't forget that, monitoring your patient's fluid and food intake is so important. It helps to prevent malnourishment. It also helps to prevent dehydration. And so at the end of the skill, don't forget to document. And of course, as with every skill, I've already washed my hands. I've provided privacy. I've provided privacy. I've put on gloves. I've explained the procedure to our patient, and now I'm going to get our patient in the safest position for someone who's going to be fed. I'm going to get him upright to a high bowels position. Is it okay if I change your position now?
So don't take gender reveal.
And Patrick is a wonderful patient actor. If anyone in Florida is looking to hire this wonderful actor, I will make sure that I have the contact information for you. And of course, right now, yes, he's giving Jesus vibes. I know it. All right, so now that I have my supplies on my table, I'm going to go ahead and put a towel on his chest in order to protect his clothing.
That is a good step in career development. Or
for the Florida Certified Nurse Assistant Examination, you always want to offer the person an opportunity to wash their hands before feeding. And the reason why you want to make sure the resident's hands are clean is because in real life, your patient may either reach up and touch you, or they're going to try to assist and touch their food, and they're going to contaminate it. So Patrick, half of the washcloth is wet, the other half is dry. Would you go ahead and cleanse your hands for me? And then flip, and you can dry your hands with the other half.
This is the vaginal opening there. Then
you would now take this and put it in the laundry basket.
So I recommend that when you're doing your verification of
during the Florida CNA examination, you will have two different food choices. Patrick, is it okay if we feed you applesauce today?
The penis is there and the scrotum.
And a song or a mnemonic that I made here at Florida Training Academy is hands, water, 3 bites, water, wipe. Go ahead and repeat that with me. Hands, water, 3 bites, water, and then wipe. If you do those 5 steps, you're going to pass the CNA examination. So I've already washed Patrick's hands. Now I'm going to give him water in order to wet his mouth. The way I like to think about it is if you are giving a patient something to eat. Let's say it's a biscuit, and they're just waking up. They have a biscuit with their breakfast tray, and they're on oxygen, or if they're on a medication that can dry the mouth. If you just give them a biscuit without giving them water first, it's going to make it really hard for them to swallow. So we're going to help Patrick by giving him water before we give him food.
Take your time. So you see, I've used these 2 modes. I have confirmed
everything went down okay.
2D.
Now we're going to feed our resident using a spoon. However, we're not going to overfill the spoon. We're only going to put half of the applesauce. We're only going to put half a spoonful of applesauce on the spoon, and we have strawberry applesauce, which is your favorite.
And then the parents can bond more.
Can you open up for me? Very good.
Baby.
We're going to repeat that 2 more times.
The case where one guy was saying that I was born with the 3 sisters, I'm the only boy.
Awesome.
So now,
and then this is the last bite that we have to provide for the state of Florida CNA examination.
I was saying now that we have a family representative, the next chief.
Good. All right, so let's go back to our sum. Hands, water, how many bites? 3 bites, making sure you check the mouth after each bite. And we want to make sure that the food really gets down. So we're going to provide water next. Here's some more water.
In our respective departments. I thank you very much.
Okay, everything went down okay? For the state of Florida exam, you cannot leave anything wet. So we just gave our resident water. We want to make sure we dry his mouth and his beard.
Enjoy the rest of your day.
We're almost done.
Hello, ladies and
Hands,
gentlemen,
water,
welcome back
3
to
bites,
Ultrasound
water,
Academy.
wipe.
So today we are going to
I
talk
want you to
about
think
one of
about
the
a person
most
who's depressed,
critical
especially depression in the
landmarks in fetal
elderly.
medicine.
If an elderly person
We are
does
going to
not
talk
want
about
to
the
live,
cerebral artery.
how would they
So the
help to
cerebral
ensure
artery is,
that they are not with us much longer?
a branch of the
I don't want to
cephalopolyps.
say how
This is
they
the
commit
cephalopolyps that you are seeing
suicide,
there.
but the way that a person would die in your nursing
This
home
is the
is by
cephalopolyps that you are
refusing
seeing
to
there. This is
eat.
the
And so
cephalopolyps.
after you
So
feed
this is
someone
the
their 3
middle
bites of
cerebral artery.
food,
So
you
the
want
middle
to
cerebral
ask them
artery
if they want more.
is
Of
very
course, in the
critical
real
in
world,
terms
you
of
feed them
monitoring
as
the
much
fetal
of the
growth
food as they want.
when
My
there
rule
is
of
what we
thumb is
call
if my patients
anuria
don't
or
eat
intrauterine
50% or more
restriction.
of 2 meals, I want you to go
can
ahead and
use
notify
this
that nurse, because we can
artery
contact the
to
doctor, we can get
see if there is
supplements
what is called
ordered,
the brain
we can
swelling
help that
effect.
person get the nourishment that they
When
need, even if they may
the
not
blood
want to
that is
eat it.
flowing
We
to
can
the
use other
brain
mechanical devices
is
to
reduced
ensure that they're getting the
resistance.
nutrients. So
Then
hands, water,
we
3
are
bites,
going to
water,
have what is
wipe.
called the
Would you
brain
like
swelling
more to
effect.
eat?
So why the brain
Would you
swelling
try
effect
another bite
happens?
for
It
me?
is
Just one more
because
bite?
the
Very good.
body tends to save those organs, which if they die,
Here we go.
they will never regain.
Did it go down okay?
The cells cannot regenerate.
And here's some more water
So
to
the brain
wash it
cells are
down.
one of those type of cells that can not regenerate once
I'm
they
so
die.
proud of you, Mr.
So the
Patrick.
brain swelling effect
Wipe your
is
mouth.
there
We're going to remove this,
for
okay?
preservation. So we want to preserve the continuity of.
You're also going to place your clothing
life.
protector in the laundry
So
basket.
that's why you see that.
Mr. Patrick, I know you normally like to lay back, but I have to give your food time to digest. So for about 30 minutes, I will lower you a little, but I can't lower you flat until your food has digested. Are you okay with that?
The middle cerebral artery. So if you get this nice image at the level of the sphenoid bone, it will be very good for you to sample the middle cerebral artery.
Take off your gloves.
So you see the waveform there. So it's a high resistance.
Dispose of your gloves in a trash can.
So
make sure that you lower the bed. If you raise it to a working height, raise the side rail back up. Leave your resident with a call bell. Don't forget to document. For the state of Florida examination, food intake is documented in percentages in increments of 25. And so he didn't eat none, he didn't eat 0, and he definitely didn't eat 50%. We document 25%. All right, everybody, this again is Nurse Eunice with Florida Training Academy. We hope that you're able to feed someone safely. Don't forget that after you feed them, don't lay them all the way down immediately. Give that food time to digest. So about 30 to 45 minutes later, you can come back and lay your patient down. You know our closing techniques. Open up the curtain, wash your hands, document, check on your patient, make sure they have the call bell. Bye, everybody.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resample to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
So you don't need to sample the wrong.
Hi, good morning.
Good
morning. My name is Eunice. I'm your CNA today, and I'm here to do your hand and nail care. Is that okay? Yes, ma'am. All right, before I begin, let me go wash my hands. Okay.
To visualize where
hands are clean.
Is. So we use this
closing the curtain.
Yeah, you're seeing
and
this
now
one
take this. Thank you so much.
You can see this one is the sphenoid bone, the white one there that we're having there. This white structure there, the base of the middle cerebral artery.
Can you raise your feet for me? Bring them over the rail.
Our sphenoid bone.
And you can lower them.
You go a little bit down to the level of the sphenoid bone.
May I hold your hand? I just want you to test the water temperature.
That's where you
Is that okay?
Yes,
very good.
On the other side,
let's test the water temperature one more time.
Middle cerebral artery.
Still okay? Yes, so I'm just going to move this over just a little bit. Okay.
If you sample the one that is closer to the
and for those who are viewing in preparation for the CNA exam, you only have to clean one hand. So we have clean water that does not have any soap inside the basin. I'm going to go ahead and keep my washcloth fold. I'm going to fold it once more.
I hope.
I'm going to wring it out over your hand. How does that feel? Good.
On how to do.
And we're only going to apply one drop of soap.
If you have got challenges or complications in terms of assembling the middle cerebral artery, you can reach out to me. Just comment on the comment section, then I can assist you.
Still feeling okay?
Depending on the machine that you're using, We can have a look at it.
Rotate your
show you
hand.
how you do the midwife
artery. I'm going to rinse your hand now.
So it is incomplete to do an ultrasound scan.
Right, so this is an orange wood stick I have to clean beneath your nails.
Rule out
so I'm going to
clean fetal growth restriction without knowing how to sample.
Am I hurting you?
Into cerebral artery. So together with the
perfect
uterine arteries and the umbilical arteries, these
your hand down.
Are very, very critical.
Support
the
it.
umbilical artery, the uterine arteries, and the midcerebral arteries are very
because your nails are already manicured. I just need to make sure they're not jagged. I'm just going to foul just a little bit. Okay.
If you're doing fetal medicine, you must appreciate the relevance of this very critical landmark. So I've done this presentation to show you how you can zoom your images nicely so that you can visualize the integrity.
Still doing okay?
Of Willis, and then you can sample
lotion
nicely. You get where you can measure the waveform nicely. As you can see here, my waveform is very nice, and you can see that I zoomed
in nicely. I need to remove the
excess
lotion, okay?
Very perfect. So I think you're learning.
You still feel okay?
Thank you so much for your time, ladies and gentlemen.
Can you raise your feet for me?
Subscribe to our channel for more. Also share this educational content with your colleagues.
Okay, so now that I've taken all the items away, here's your call bill. Is there anything else that I can get for you right now? No. Okay, I'll come back and check on you during my next round, okay? Okay. All right, I'm opening up the curtain.
There is also an illusion that we've seen.
I'm going to go wash my hands
so I need you to
and document if I have to do
pay
so.
particular attention to it, then we will discuss it.
Everybody, this is Nurse Eunice with Florida Training Academy. So this was our demonstration on how to provide hand care for the state of Florida exam. You can watch our videos on YouTube and also on my personal channel, which is nurseeunice.com. We'll see you in the next video. Bye-bye.
See that these fetal bowels are echogenic there.
All right, so this is our foot care skill, and we have the wonderful Tanisha here who's helping us for the state of Florida examination. You only have to perform foot care on one foot. We have a towel on the floor because the barefoot cannot touch the floor. We also have an additional towel that we'll use for drying. We have washcloths. We have a basin of water that is comfortable. We've already had Tanisha check the water temperature. We also have soap and lotion. Notice that we do not have any toe utensils. We're not trying to clip toenails, and we're also not going to foul toenails. That is not a CNA duty in the state of Florida. All right, so before I begin foot care, I'm going to go ahead and put on some gloves.
Some congenital infection that is.
Can we have you check the water temperature with your hands? However, now I want you to check it with your foot also. Can I get you to check the water temperature with your foot? Is it still okay? Just a little bit. All right, we're going to begin the washing process.
B19 infections can also
we're going to wet it, bring it out,
we can also
apply 1 drop of soap.
Meconial ileus, bowel obstruction.
I'm going to bring your foot out just a little.
Intestinal ileus, you have bowel villus, bowel perforation, and some of the things that can also cause echogenic bowel. So when you're doing an ultrasound scan, then you'll see
I'm also going to clean the bottom of your foot. How does that feel?
Fetal bowel, you must always comment on that. Don't ignore it. It can also imply that there is an
and this is a really easy skill. Pretty much, I wash the foot, I rinse the foot, and I dry the foot. So I'm going to support your foot. I'm going to bring it out. Great job. I'm going to move this over.
Like that.
I'm going to put this on the floor.
So persistent echogenic bowel can also be a challenge because it can cause.
I also have to make sure that I dry between the toes.
So you
still doing okay?
Yes, to report on it. Don't ignore this when you see it.
Now, as far as lotion is concerned,
that's not my main focus or my main challenge for the day. I need to show you something that is a greatest masquerade. There is something that is coming that I need you to appreciate and see. Look at this. What is this? Guys? Look at this. This is the placenta. What we have.
Great job. And for the Florida exam, even though we normally let this absorb, I have to remove the moisture right away. And just as a reminder, we do not put lotion between the toes.
Look at it. That item there.
Take this away. Great job.
So it looks it looks like here it looks like it's an encephalocele.
So now I have to assist you and put your shoe and your sock back on. So let me support your foot. Thank you so much.
So which is which? So this is one of the greatest challenges. You see, the fetal head is here and the lesion is there. It's coming there. What is that? What is that? You see, this is the placenta here. It looks like it's attached to the fetal head, but in this orientation, it's not attached to the fetal head.
Right, so once you've completed foot care, you want to clean all your items. Of course, you're going to rinse and dry your basin, store everything where you received it from, put up your dirty linens, your dirty washcloths and towels, and then you have to take off your gloves. The proper way to take off your glove is that you'll pinch from the palm, pull down,
placenta
contain the removed glove into the dirty glove, and then you go under, remove the second glove. Take this to the trash can, wash your hands, and you know how we end every skill. We make sure our hands are clean, that the curtain's open, that our resident has a call bell, and that if we have to document, we do so for the skill. This is Nurse Eunice with Florida Training Academy and nurseeunice.com. We'll see you in the next video.
Just go to the morphology or appearance of an encephalocele, but it's not an encephalocele.
All right, so this is Eunice with Florida Training Academy and nurseeunice.com, and in this video, we're going to be performing the transfer from the bed to the wheelchair skill. As we begin every skill, we always want to knock and introduce ourselves. Don't forget to wash those hands, provide privacy, and remove the call bells.
The heart is fine, then this thing. So if you're not careful, you are going to mistake this one.
So let's prepare our wheelchair. Before we put a patient inside of a wheelchair, we first want to lock the brakes. The pedals or the footrest should be up.
The fetal brain there.
And then there's usually a lever on the inside of your wheelchair that once you engage it or pull it, it should allow the leg of the wheelchair to go back. So when you're putting a patient in a wheelchair, there shouldn't be anything for your patient to step over. Let's do this again for classroom purposes.
So this could just be a normal hemorrhage.
All right, so I just pulled my wheelchair to the patient's bedside. What's the first thing I do to ensure safety? If you said lock the brakes, you're absolutely correct. Let's lock the brakes. You don't want your patient stepping over anything because they can fall. So we're going to raise the pedals and then move the legs out of the way.
Some of the things that we have to make peace
and
with.
This is how you prepare your wheelchair for a patient to be transferred from the bed to the wheelchair.
For medical ultrasound. So fetal ultrasound is one of those
Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to put you in a wheelchair. Is that okay? All right, before I begin, let me go wash my hands. Okay? And so don't forget to wash your hands. Hands are clean. We're going to provide privacy by closing the curtain. And I'm just going to remove this because we don't need it right now. How are you feeling today? I'm going to prepare my wheelchair first.
Umbilical cord as well.
So I'm going to lock the brakes, as we showed you in another video. I'm going to bring the pedals up, bring the leg of the wheelchair back,
so there's a lot of work
and repeat the process on the opposite side.
That is involved. So I don't need you to rush this thing.
Okay, I'm going to gather your legs and bring them over. Okay, can you scoot over a little bit for me? It'll be a little bit easier. Perfect, and 1, 2, 3, let's go ahead and get you on the side.
I highlighted this case because it's a
all right, we have to make sure that your feet are on the floor, so I'm going to try to lower the bed a little. And this is as low as the bed goes. So let me get you some shoes on.
Due diligence, you can see that it's
and then we want to make sure that your feet are touching the floor.
So,
can you touch the floor for me? Great job.
I thank you so much. If you are paying particular attention,
we're going to apply the gate belt, and this just helps me transfer you safely.
Otherwise, we are going to be very, very horrible practitioners. Don't forget to turn on the notification button and then also subscribe to our channel. Let's keep on growing the community so that we get engaged.
Doing a 2-finger check, making sure the only 2 fingers fit inside of the belt. Are you feeling any discomfort? Okay, so our feet are on the floor. I'm just going to bring this wheelchair a little closer.
To get in touch with me, my name is Last.
I'm going to park your legs just a little.
In any capacity, you can type the comments.
So now your arms go on my shoulders. And on the count of 3, I'm going to stand you, turn you, and sit you into the chair, okay? 1, 2, up on 3, turn and sit. Great job. How do you feel? I feel good. And so now?
Sometimes there's a war, there's conflict
put 2 feet
between
on one
religion
pedal
and science, spirituality.
And I don't have to lock the wheelchair. The wheelchair still moves side to side, even though it's
a lot of challenges.
If you don't feel comfortable doing that, or if your patient's heavy, you can't unlock the brakes, but do place the lock back.
So,
because for example, say an exam, your patient's not going anywhere. They're just going to be in the wheelchair for a little bit.
So we were this couple. So this couple, they wanted a girl child. They've got 6 boys already. So they are looking for a girl.
Mm-hmm. So here's your call bill. Is there anything that I can get you right now?
They are past their prophet. They said now this one is a girl, you know. So they
right. I'm opening your curtain.
They came for the sauna.
Washing my hands.
Very excited.
And you are done with your skill. We'll see you in the next video. This is Nurse Eunice with Florida Training Academy. Bye.
For the first time in their life, it was very temperamental. They were very, very excited.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com.
Hello, everybody, and welcome back. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy. In today's video, I'm going to show you how to perform range of motion exercises to our patients' upper extremity and also lower extremity. Performing range of motion exercises is extremely important. Not only does it loosen stiff joints, it also helps to prevent atrophy or muscle wasting. Remember, if your patients don't use it, they lose it. So you want to encourage them to use their muscles, to move things, to actually comb their own hair and participate in their care. Additionally, something else that you may not consider is that whenever you have a person move around, it improves their circulation and they're less likely to develop blood clots. All right, so we have our wonderful patient actor here. His name is Patrick, and we're going to go ahead and begin. I've already washed my hands, provided privacy. For this skill, I will not be wearing gloves. Let's go ahead and start. All right, so I'm going to start off by exercising your shoulder. Do I have your permission to do so?
Yes.
All right, so let's go ahead and straighten out your arm.
Emotional experience.
If during this process you feel any pain, just let me know. All right, so I'm going to bring your arm all the way up as far as you can tolerate. Very good.
Determine the outcome of everything.
1.
Then what they need from you is just you rubber stamping.
2.
The whatever.
And 3. Very good.
They found it.
I'm now going to bring it out towards me.
This is
1.
One of those cases.
2.
So the way we were now
and 3. And next we're going to do rotations.
To say,
okay,
you guys
bring it out.
Look at that.
Just
this is a boy. You
1.
Know, they
2.
They denied. They were denying it.
3.
They were denying it.
Great job. Did you feel any pain?
I
so I'm just going to fix your shirt just a little bit. And so now we're going to exercise your elbow. I'm going to take my supporting hand, go beneath your elbow, and we're going to do 3 curls.
Then I had to take
1,
through the whole session,
2,
but they were getting
and 3. Still doing okay?
Mm-hmm.
All right, I'm going to exercise your wrist. I'm just going to gently support. I'm going to have my hand on your palm, and we're going to go down 3 times. 1,
beyond
2,
and
3.
Above
and for camera purposes, I'm not extending, bringing the arm back or the wrist back too far. I'm just going down in a natural position 3 times. And then next we're going to go side to side
you see that maybe the fetus
3
is dead
times.
already, So
last will be our rotations. 1, 2, 3. So let's repeat that. Down and up 3 times. Side to side 3 times. Rotation 3 times. For the state of Florida examination, you do not have to exercise fingers. However, if you know that one of your residents has arthritic fingers, that could be something you can talk to the physical therapist about or the physical therapist assistant so they can show you how to relieve those stiff joints. Now we're going to go down to the lower body. So Patrick, now I'm going to exercise your leg. I'm going to go under the calf and support and also under the mid-thigh, and we're going to go up 3 times. Let me know if you feel any pain.
So how
1,
do you handle such cases?
2, 3. I'm now going to bring your leg towards me, the same as we did with your shoulder.
How are you going to handle
1,
such a case?
2,
Was I going to
3, and now we're going to do our hip rotations.
I can't see
1,
the gender.
2, and
Was
3.
I going to
Everything
that,
okay?
the
I'm going to
prophet said
exercise
the
your
truth,
knee. I'm going to put my supporting hand
was
beneath
I
your knee. And I'm also going to take my other hand and go under your heel.
just
And
paid
that's
their
going to
money
prevent your heel from
specifically
dragging.
for
I'm
the
going to go
gender
up 3
confirmation,
times.
for the rubber
1,
stamping and to
2,
give eulogies and
and
everything
3.
to whoever
Still doing
did whatever,
okay?
you understand?
Now we're going to
needed that.
exercise your ankle.
They wanted
Let me
to give the
support
men of God
your
the
heel
kind
so
they
it doesn't
deserve, you
drag.
understand? They were all
We're going to go
the
down
esteem that
3
they had.
times. 1,
So
2,
the practice
3.
of
We're going to go side to
ultrasound
side,
has
the same way we
other
did with your wrist.
attributes that
1,
we need to cultivate and that we need
2,
to have. Besides
3, and now we're going to do those rotations. 1,
So it
2,
goes beyond
and 3.
the daily attritions and abrasions of you searching for anatomy, identifying.
So is it okay if I lay you down some?
Yes.
And the major issue is
So
the
we're going to lower the head of
emotional,
the
the
bed.
psychological issue associated with ultrasound scan and the disclosure.
But we're also going to bring the bed up to a working height.
How do you do at your practice? Do you disclose such information? Do you keep it yourself? If you keep it yourself, how do they value you? Do they see you as a competent somebody, or they will see that this person is a robot or doesn't know what he's doing? You understand? I don't know. How do you handle
Lower the side rail.
this talk? Please do help me. Where in the country where you are working, can you just come?
Can I get you to come closer to me,
and
please?
say that I'm working in Romania?
Can I get you to turn away? You're welcome to grab
How
onto
do
that
we
rail.
handle such
Thank you.
issues? What are the legislation? What is relevant?
Try to keep your resident covered as much as possible during the skill.
At our branch, at our department. To me, it was more like traumatizing. It's like just.
And now I'm going to roll
against the clock of
this
others.
bottom fitted
Others
sheet
are
in.
moving in a positive direction. They are going wherever they are.
And then I'm going
against
to
them,
push.
It's quite emotional.
Push.
It's one of those things.
Push.
It's very difficult, guys. It sounds
Push.
as
If the mattress was sold, we would raise the side rail, then go get you a washcloth, a towel. You can cleanse the mattress and dry the mattress. And another technique I'd like to use is I would push a dry towel under the patient. That way, there's no way that my new linens could be contaminated by the old linens. And so if you need a demonstration on that, just let me know. Put it in the comments, and I'll make that video. But for your state of Florida examination, there will be nothing on the mattress, so you can just proceed. Let's recap. So far, what I've done is I have safely gotten my patient onto their side. I have rolled in the dirty bottom sheet, and I maintained privacy throughout. Now I'm going to start applying our fitted sheet.
I don't know.
Check on your resident to see if they're okay.
I'm ready for the conversation, guys. Let's bring the
Mr. Mitchell, how are you doing?
I'm doing good. Thank you, guys.
And build upon it. Thank you so much for your time.
And then work your way
I
up
need you to share this
towards the top of the bed.
Develop a community.
Making sure that the corner of the fitted sheet aligns with the corners of the mattress.
And knowledge together.
And then tuck whatever material you need to tuck
for the good of the patients. I think it's
under the mattress.
Hello, everyone. How are you doing? Here we've got a case.
I like to roll
fetus,
my fitted bottom sheet. Clean and your dirty sheet, they can meet, but they should not
you can see
overlap.
The
so
the fetus. You see this, the blood of the fetus. That is.
I have no wrinkles. All right, Mr. Mitchell, I'm going to lay you back.
Look what I saw there.
You still doing okay?
Yes,
Can you center yourself in the bed for me?
You can see the bowels there.
So what I like to do now is I call this demummifying my patient. I don't want to get him wrapped in these sheets. So what I'm going to do is I'm going to just release the top sheet at the foot.
It's also very much distended, as you can see.
And I'm going to bring this fold of the sheet over. So now I have a clear view of my dirty linens. And I'm going to ask my patient to come towards me. And if you come towards me, and so you'll stand on your back, just bring your whole body towards me, and now turn away. 1, 2, and 3. Great.
You can see.
Make sure you keep your resident covered as much as possible. Fortunately, our patient has on pants, so their bottom isn't exposed. But if that's not the case, if your resident has on a gown with no underwear, with no pants beneath, just make sure you pull that top cover over a little bit more. So now we have to remove the dirty fitted sheet. I'm going to lower the side rail.
This is the bladder that is stretching all the way. Like that.
When we're removing our dirty linens, we don't bring anything towards our uniform. We roll it away from us. So watch me. I'm going to roll it in and then roll it away. Every few minutes, just check on your resident. Mr. Mitchell, are you still doing okay?
I'm good. Thank
There's
you.
a difference between gastroschisis and omphalocele.
And of course, this is going to go in our laundry basket.
Intestines will be
so
protected
now we
by
have to
membrane,
pull down. We have to pull this fitted sheet so that it fits the mattress. And then don't forget, we can't leave any wrinkles. So let's do it together, team.
So this is just
we're going to
12
pull
weeks
taut
of pregnancy.
And we're going to lift the mattress and
Look
tuck.
what's going on there. Look,
Pull taut and tuck. And keep doing that all the way. Pull taut and tuck.
See here.
Pull taut and tuck.
The distension of the bowels. There. But the fetus is alive.
This is what it should look like. Your patient should not be laying on wrinkles because wrinkles cause bed sores. All right, let's get our patient back onto his back. Mr. Mitchell, you're doing such a great job. Let's get you on your back. Let me get some of those wrinkles out your gown, and you can sit yourself in the bed.
The blood, are they going all the way?
For this next part, you don't need to lay flat. Okay, I'm going to raise you just a little bit. You still doing okay?
This is the amniotic set.
Now that we have our patient centered in the bed, what I've done is I have raised this top dirty sheet. I don't want to totally expose him yet. As I'm preparing the new top sheet, what I'm going to make sure of is that we have a clean area to unfold. So watch as I unfold now. And I've already set Mr. Mitchell up. If you think about the elderly population, a lot of them do not like to lay flat for long. So you had them flat while you were changing the flat fitted sheet, but you can sit them up a little bit because the hardest part of this skill is now done.
All the movements, that's the heart.
So I like to allocate some of the top sheet over the footrest.
You can see, you can appreciate it.
Because this will allow me to tuck the top sheet and to make my miter corner.
Look at the cysts there in the cord. Look at how.
Now, before I go any further, I just want to make sure that it is even on the side. So this skill requires you to do a lot of backwards and forward, but it's going to be worth it because your patient's going to have clean linens. And that's going to help them sleep better. Okay, so now that my top sheet is halfway in position, what I like to do now is I like to make a tent. Imagine there are some visitors in the room or a family member who wouldn't leave. I'm going to hold the clean top sheet up with one hand and then remove the dirty sheet. Once the genitals are covered, once their private area is covered, I go ahead and then I take two hands and I remove this top sheet that was dirty. Don't bring it towards your patient's face. Bring it away and put it in the laundry basket.
Look at this. Look at that. Look at that. So this.
If your gloves are obviously contaminated, of course you could change them. But remember, for your test, we're going from semi-clean sheets or clean sheets
and also make
to more clean sheets. So,
gastroschisis.
Thank you so much for your patience. I'm sorry it's taking longer than anticipated. We're just making sure we're training future healthcare professionals. All right, so let's prepare for our miter corners, or you can also call this your hospital corner. I'm going to lift one half of the mattress.
The baby is too small. It's very difficult to visualize the kidneys nicely.
Repeat that process on the other side.
If there was
lift half of the mattress and tuck.
Pockets.
Now that we have the top sheet tucked at the foot, repeat these words with me. Up.
Around here.
Tuck.
I can't see that. You can see the limbs there, the fetal limbs.
Down.
The fetal limbs. Look at how big.
I'm going to undo that.
Look
so,
how big.
Top sheet is tucked at the foot. I want you to bring the first layer up at an angle, make a V.
The problem of gastroschisis, it can only be managed after delivery because the cord,
the part of the sheet that's nearest the mattress, and now bring it back down. That is how you'll get your miter corner.
You can see the heart rate there.
Tuck, down.
So the fetal heart rate looks fine. And the heart rate looks
I'm going to repeat that process on the opposite side.
There are no issues with the heart.
Tuck,
So gastroscopy
down.
because the intestine, the
As a reminder from the prometric CNA examination, you do not tuck the top sheet along the sides. If you do so, that would be considered a restraint. So you only tuck at the foot of the bed, but then to make sure that your patient or your resident has room to wiggle his or her toes, just make a little tent and that's going to wiggle their toes, wiggle, wiggle, wiggle. And if they can wiggle their toes, we also know they have enough room to move their heels, and that way they're going to be less at risk of getting a pressure sore. And so we had 3 linens that we needed to change. So far, we've changed the bottom sheet and the top sheet. Don't forget to change the pillowcase, you all. That's one of the easiest ways to not be successful on your CNA exam. So top sheet, bottom sheet, pillowcase. Let's get that done now.
In the first trimester. Okay.
Mr. Mitchell, can I use to raise your head for me? Thank you so much.
I hope.
As long as you don't shake the pillow out of this case, you're doing a good job. I need for you to keep being patient. Remember, if you get this skill, you will more than likely have upwards of 40 minutes to complete your test. So don't rush. You can do it. All right, I'm going to simply grasp the pillow.
And also,
and then
appreciate
with just pulling, I'm going to remove the case. I'm not going to shake. And this goes where, everybody? On the floor?
Kindly share with
You're
us.
right. Laundry basket, which I have right here.
Thank you so much.
And most of your test sites, you can either put the pillow towards the foot of the patient's bed, or you can put it on the bedside table. Do whatever you feel is best. For video purposes, I'm going to put it on the foot of the bed.
In pregnancy, you can also find fibroids. So
now I'm going to prepare my pillowcase. What I like to do is you can scratch, but the end goal would be for you to be able to see the internal seam of the pillowcase. So once you can see the internal seam of the pillowcase, I like to go seam of the pillowcase to seam of the pillow with the tag side inside of the pillowcase. So let's go seam to seam. You all follow me, seam to seam.
So this one is small.
Lift the pillow.
It's not really interfering with the,
and pull
with the
down.
Pregnancy.
How easy was that? I didn't shake, and I did not put my arm all the way in the pillow. So seam to seam. I want you to practice it at home. And now, even though it's not a requirement, we usually tuck. I call it making an envelope. And so the way I'm going to do this is I'm going to just going to lay it down so you can see it better. I'm going to tuck one end of the pillowcase in onto itself, then tuck the
foot there.
Next end.
So this was it.
So this is what it's going to look like. Okay? Mr. Mitchell, can you raise your head? All right, yes, sir. You can lay back now.
The hand there, the fingers.
Let's take off these gloves. Do you remember how to do so? Yes, that's right. We're going to pinch about 1 inch beneath the cuff. We're going to pinch and pull off. And now how do I take off the second glove? I'm going to take 2 fingers. I'm going to go under, remove, and then pull off. I'm going to discard of this in the appropriate waste receptacle. So once my gloves are off, I need to go wash my hands, but I have to make sure my patient is safe first. So I want you to tell me, what do I do now? You are so right. That's right. I have to lower this bed down to its lowest position because right now it's up at a working height. This would present a fall hazard. So let's lower the bed down.
We also screen for Down syndrome and also for preeclampsia. So what I wanted to demonstrate is the fibroid, the existence of a fibroid with pregnancy.
Great. Now, do I just wash my hands and leave? Or am I forgetting to give my patient something important? Yes, I need to give him his cold light.
That are developing nicely there. So this is the ductus venosus.
Hey, Mr. Mitchell, here's your cold light, okay? Just call me if you need anything. Do you want your glasses back?
Yes, please. So that's an abnormal ductus venosus waveform.
Thank you. You're so welcome.
So you must
I'm going to put your bedside table here. When I come back in the room, I'll bring you some water, okay?
Thank you. That's
You're
not
welcome.
the focus of this presentation.
And as we do with every skill at the end, our patient has a call light, they are comfortable. I'm going to go wash my hands. I'm going to open up that privacy curtain, and don't forget to document. And so everybody, this is Nurse Eunice with Florida Training Academy. Yes, I have a workbook that's out that covers all of these skills. You can get that book by going to booksbyeunice.com or just looking for the link in the description area. And I'll see you in the next video. All right, Mr. Mitchell, I'll see you during our next round.
Nicely.
All right, so Patrick, I'm going to be changing your position. Okay? And your doctor wants you on your left side. If I can get you to come towards me just a little, that's going to ensure that I don't have you too close to the other edge of the bed. And now if you can use that handrail, I'm going to help you turn. And we're going to get you to your left. And so I'm going to bring your hips back just a little. Great job. Straighten out your clothing.
Determine the sizes. Unfortunately,
are you still doing okay, Patrick? This first pillow I'm going to put behind you. I'm going to lean you just a little bit.
Stage, you can't remove the fibroids when the pregnancy is growing like that. So you can see the nasal bone.
It's going to be uncomfortable for a few moments. I promise you it'll feel better. All right, so now that I have this pillow rolled and tucked against your back, if I can get you to come back just a little bit, and you can release the rail.
So
now, Patrick, I'm going to bend your knees, okay?
They just get pregnant without.
I'm going to be parting your legs to put a pillow between them.
When they get pregnant, like now, this.
Sorry if my hands are cold.
She's complaining of pain, lower
now I'm making sure, I just want to go back and recheck everything to make sure your knees are not touching and that your toes and your ankles are not touching.
Compressing the
want to take this arm.
The fibroid when it's compressed.
Want to make sure you're not laying on this arm too much.
Problems.
Very good. I'm going to bring you a pillow to hug.
So it's very advisable that before someone gets pregnant, they just have to be checked for the fibroids.
You still doing okay?
The data, if they can be removed.
All right, so for our fourth and final pillow, can I please ask you to raise your head just a little? I want to make sure this pillow is cradling your neck and supporting your head. How does that feel?
You can just have to tolerate the pain.
All right, so Patrick, I'm going to give you this call bell, okay? All right.
Pregnancy.
And so if you need anything, please call me.
We hope.
For the state of Florida CNA exam, of course, you'll pull back up the covers. You would not overexpose your resident. The students at our CNA exam prep course here at Florida Training Academy will actually go through all of these skills. Just make sure your pillows are properly placed and that you are protecting the bony prominences such as the inner knees, the ankles, and the toes from touching each other in order to prevent a bed sore. In the real world, you'll change your patient's position at least once every 2 hours or more often if your patient experiences pain. At the conclusion of your skill, lower the bed all the way down. If you lower the rail, make sure you bring it back up. Don't forget to wash your hands and open up that privacy curtain. I hope that this helped. If you have any questions, our website is fetaltraining.com, and we look forward to training you and seeing you in our next video. Bye-bye.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
It's anechoic black, round, oval structure.
Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to take you for a walk. Is that okay? All right, before I begin, let me go wash my hands. I'll be right back.
So the decidual reaction site
hands are clean.
The bright echogenic rim surrounding the sex. So this is what we call the decidual reaction that we see. It confirms pregnancy.
How have you been doing so far? So this is a gait belt, and we're going to use this to walk you. Are you having any problems, any weakness today? So if I can get you to pull your legs back just a little bit for me and raise your arms.
That we have there, that's a gestational sac.
I'm going to put this gait belt around you.
So the next step, yolk sac.
Thank you so much. You're welcome to lower your arms now.
6 weeks. Then the embryo.
Just want to get your hair out the way.
Then the confirmation.
I have to make this a little snug. I'm putting 2 fingers in.
Uterine pregnancy. So the normal size, gestational sac, 2 to 3 millimeters. Visible at the 4.
Okay, and our feet are on the floor. Great job.
It's on the calendar. It can be noted from 4.5.
On the count of 3, I'm going to lift you a little, okay? 1, 2, 3. Let's stand. Great job. Are you dizzy? All right, we're going to take 10 steps. Let's go. 1, 2, 3, 4, 5, 6. All right, we're going to say that's 10 because of the limitations of our room. And now we're going to turn back towards the chair. And before I walk you any further, are you dizzy? All right, let's take our 10 steps back.
So
great job.
Go to question number 1. Which structure is the first to be seen within the...
Let's turn. I want the back of your legs touching the chair. All right, and so we don't have a chair with armrest, but the bed has an armrest over there. So if you'll feel for the side rail, and on the count of 3, 1 to 6. 1, 2, and 3.
Placenta.
Great job. How do you feel? Okay, I'm going to remove this gate belt.
Within the gestational sac, embryo, the amniotic sac, the yolk sac, or the...
I don't want to tear your skin, so remove this carefully.
Then let's discuss. Then
here's your call bell. Is there anything else that I can get for you right now?
Question number 2.
I'll be back on my next rounds, okay?
Gestational sac diameter.
It's up.
The embryo normally be visible on trans.
Well, open up the curtain.
10 millimeter.
Wash my hands. Before you say that you're done, make sure you've done everything that's required for the state of Florida CNA examination, such as making sure your hands are clean, that your patient has the call bell, that if you provided privacy, that you open the curtain back up, and at the test, if your nurse requires you to document, make sure that you also document the skill. This is Nurse Eunice, everybody. We'll see you in the next video.
B, 15 millimeters, C, 25 millimeters, then D, 35 millimeters. Question number 3.
In today's video, we're going to be showing you how to dress a resident who has a weak arm. And to me, the skill is a little bit unfair if you have the skill on your certified nursing assistant examination. And the reason why I think it's unfair is because you're supposed to be dressing a person who has a weak right arm. However, you're dressing a mannequin who, you know, if you think about it, would be more like dressing a quadriplegic in traditional clothing. If we had a quadriplegic, we usually have more adaptive clothing that has snaps and Velcro. Regardless, we're going to perform this skill. We're going to pass our test. You all know how we always begin. We've washed our hands. We've knocked on the door, washed our hands. I'm going to go ahead and put on some gloves. I've provided privacy. And of course, I've explained the procedure to the patient. In this particular instance, because it could involve nudity, this skill will be played on a medical mannequin. And the nurse at the test site, the evaluator, will answer on behalf of the mannequin. All right, so I've asked the resident which garments would they like to put on. I gave them a choice of 2 tops, and she said that she wanted to wear this top. So now that our resident has chosen which shirt she'd like to wear, I'm actually going to conserve some of my strength. I like to start off with dressing the bottom half of the mannequin first. So I've done my introduction, washed my hands, I'm applying gloves. Privacy's been maintained because I pulled the curtain. I'm not overexposing a resident. I'm exposing exactly what needs to be exposed. She still has her gown on. I've uncovered her feet, because I'm going to start off with placing the socks.
Which measurement provide the most
I'm going to open up the socks, open up the opening, stretch it out a little bit. Don't pinch on their toes because they could have gout, which is a painful, like an inflammation of the toes. I'm going to spread the sock just to make sure, smooth it out, just to make sure there's no wrinkles. Remember, we don't leave wrinkles in our residents' clothing or in their gowns because those wrinkles could cause an irritation or an indentation that could later lead to skin breakdown, aka a pressure sore.
Condition A, placenta previa. B,
all right, Miss Lucas, you're still doing okay?
Syndrome, trisomy 21.
Great. We're going to start next with your pants.
Polyhydramnios.
I'm not going to overexpose. What I'm looking for is the tag within the pants, so I know which way to place the pants. And so the tag goes towards the back.
Placenta previa. B,
I'm going to gather up one leg of the pants without putting my hand or my arm all the way through it. If you do something like this, you're contaminating yourself, so you don't want to do that. Instead, just gather it up from the outside.
Associated with the molar pregnancy. Which ultrasound sign is classically associated with the molar pregnancy?
And now repeat the process on the opposite side. Remember that for our video purposes, I don't walk around to the other side of the bed as much as I would in the real world. So at the test site, if you're not able to get the leg, the resident's leg into the pants from one side of the bed, feel free to walk over to the other side. Okay? So now that I've done that, My next task is to bring those pants up without overexposing the resident. So I'd like to find the waistline, and as I shimmy the pants up, I also bring the gown up.
So please try to give the answers in the comment section, then where you can take it together, then we discuss more.
And it's a lot easier to do this if your patient is flat. Anytime we're repositioning a patient, you want the head of the bed to be in the supine or the flat position. All right, and so my pants are now placed.
D, embryonic cardiac activity.
Just want to make sure it's
question number 8. Which
covering up her bottom. I'm going to raise you just a little bit, okay? Great.
A, thick endometrium. B, gestational sac.
I'm now going to walk around the other half of the bag in order to remove the sleeve from the left arm. Whenever you're undressing, you undress with the strong arm first. Undress the strong first, but dress the weak first.
Which condition
going to raise you up just a little bit.
The ring of fire appearance on Doppler. A,
going to untie you down.
B,
thank you so much.
corpus luteum cyst. C, endometrial polyp. D, uterine fibroid. Which condition?
And yes, the gown has snaps, and this would be something similar to an intravenous line. However, for your state of Florida examination, your patients will not have IVs, so you don't necessarily have to have a snap gown. I cannot guarantee whether the gown will have snaps or not, which is why I'm teaching you how to remove a gown the traditional way. So I've now undressed the strong arm.
Corpus luteum cyst, endometrial polyp, or uterine fibroid.
And if you feel comfortable, if you feel like lowering the rail, you can. Sometimes I work around the rail. This was, safest for your patient, of course, but also your comfort level. And right now, I'm comfortable working with the rail there. As with the pants, I'm not going to stick my arm into the sleeve. I'm going to gather the sleeve like hosiery. Gather it, gather it, gather it. I'm going to make sure I open it up. I'm going to support the hand as I bring the sleeve up. Let me know if you feel any pain.
The yoke sac or the amnion.
And I'm going to allocate the front half of the jacket.
These are our 10 quiz questions. So try to attempt
at the test site. There'll be a nurse. You can ask her for turning help, but I'm used to maneuvering patients, so I'm going to turn her by myself. I'm going to go ahead and cross your legs.
Answers for self-assessment. Do not cheat.
I'm just going to turn you a little bit. I'm going to support this arm, so I'm going to go under the arm, hit the hip and the shoulder, and on the count of 3, we're just going to turn a little bit. Okay, 1, 2, 3, and let's turn.
You can see.
Make sure that you bring the gown forth.
That you can
make sure those pants are on well, and our pants are on.
Thank you so
and now
much.
I'm going to push this through.
In the quiz session. Enjoy the rest
making sure that I get out as many wrinkles as possible, and I can always finish the de-wrinkling process. That's what I'm going to call it when I get through to the other side. Remember, with this arm, you have to support it. This is the weak arm. So if you do this, they're going to count you off. They're going to mark you off. So you want to make sure that you actually support that arm. I'm going to reposition you some, okay?
Hello, and welcome back. So
I'm going to uncross this leg.
The answers to our obstetrics.
Walk back around.
So I will discuss and give the explanations. Thank you to all those who.
So this is one of those skills where if you get this during your exam, you're pretty much given more time. And so for a state of flow examination, you're given 31 up to 41 minutes to complete your 3 skills, which include hand washing and gloves. But if you get this skill, chances are you're going to be the one who will receive close to 41 minutes to complete their test. So now I just have to simply move my patient, turn her, bring the jacket out, and now dress the strong arm. The weak arm is dressed. I'm going to move you over towards me some, okay?
The answer is C, which is the yoke sac. Explanation. The yoke sac is the first
to make sure my patient does not roll too far. I've been in leg nearest me, bend that knee, turn her. On the count of 3, we're going to turn, okay? 1, 2, 3.
It is the one that we use to identify that this is indeed an
I'm going to bring this jacket out.
Pregnancy. In the first
correction if not overexposed.
From pseudo pregnancy.
This tends to be the hard part, believe it or not, because
also present.
Remember,
so the person
supposedly the mannequin has a weak right arm, but it's a mannequin, so all of the extremities are weak and they're stiff. So it's really hard for me to get this jacket onto the arm without me overextending the arm. So I'm going to go ahead and apologize if I bend your arm too much. In the real world, we would not be using this type of a jacket on a patient who was a quadriplegic. So this again is one of the reasons why I think this skill is not the best skill. It's not realistic. I'm going to straighten out the wrinkles, make sure they're all removed, turn my patient back towards me, reposition her, correction for not supporting that hand. You all heard it hit. I don't want to get marked off.
So if you see that there's no fetal
before I can remove that gown, I'm going to have to fasten all of the snaps
25 millimeters
and or buttons.
We don't rush to say this is a blighted ovum. So explanation in MSD of which is greater than or equal to 25 millimeters without an embryo is a diagnostic of pregnancy failure on transvaginal ultrasound. So it will be an indicator of a blighted ovum.
I can now take this to the laundry basket.
Number 3.
Always keep your patients nice and neat.
8 millimeters, but no cardiac activity is seen. What is the most likely?
The pants are a little bit bigger than I would have liked, but we have totally dressed our mannequin.
But no cardiac activity.
There, so I can get rid of some of those extra wrinkles.
A, normal early pregnancy. B,
compliment your patient on how well he or she looks.
C, pregnancy of unknown location. D.
So don't forget to give your resident the call bell to hold. Make sure you open the curtains so that they're not left claustrophobic. Wash your hands. If you have not lowered the bed, make sure you do so. And if you have taken down or lowered the side rail before you ever leave your resident, make sure you pull the side rail back up. One more thing I want to state, that for the state of Florida examination, whether the rails are there or not, that does not pass nor fail you, because your state of Florida examination is geared toward all adult populations. And people who are in the home care, they may not have medical beds. They can have traditional beds. So as long as you can turn someone safely, and you can do so without them falling off the bed or getting too close to the edge, whether a rail is there or not, you should be good. All right, if you have any questions, you can find us at fltraining.com. And if you want to take a CNA exam prep course or a CNA trainer course right here in Florida, you know how to find us. Have a great day and goodbye.
Adnexial gestational sac containing a yolk sac or embryo. C, thickened.
In today's video, we're going to be showing you how to perform the skills that are needed in order for you to pass the prometric CNA examination. I'm based out of Florida, so if I'm showing you something that is different than what your instructor or your school has taught you, then of course I need you to go by your formal instruction. And then also, disclaimer, the training that we're providing here today does not substitute a accredited CNA program. It's to help those who are ready to take their test, just review their skills, and also we have playlists with multiple practice questions. If you're in Jacksonville, Florida, and you actually want to come to our facility to learn the hands-on skills, we have the CNA exam prep courses, which are 2 days, and they are great for pre-med, pre-nursing students. It lets you get in, focus on your skills, and the majority of our students pass on their first attempt. All right, so let's get started. The skill that we're going to be showing you right now is going to be perineal care. And perennial or perineal care can be performed on both men and women. However, for the state of Florida examination, the skill is performed on a woman only. And we're going to begin with our normal procedures. We've provided privacy. We've washed our hands. And now we're going to don gloves, which means put on gloves. And of course, we've already told the patient about the procedure and what we were going to do. So let us begin.
So the correct answer is C, the crown rumpling CRL. Explanation: CRL is the most accurate measurement for dating pregnancy between 6 and 18 weeks. So we use the crown rump length, which is
right. So I'm applying gloves to my clean hands, and I have my supplies. I have my table here that has towels, washcloths,
So we use the CRL to date the pregnancy.
A bath basin with warm water, and then also soap. For the state of Florida exam, we begin by actually changing the bed pad that's beneath the resident. You would not do this in the real world. You're only doing this for the state of Florida CNA examination. I have the rail down on the side nearest me. I'm going to remove this cowbell because I don't need it. I'm right here with the patient. Whenever you're maneuvering someone who cannot turn themselves, it's a good ideal to move their body incrementally. And then I'm also preparing the pad in advance. So I'm going to roll it halfway in. So I have everything I need. Now I'm going to move my patient towards me for safety. Shoulders,
Down syndrome, and some structural
hips,
abnormalities.
And then legs. I am going to expose her a little bit more than what I normally would, but remember the curtain's already pulled, and then I'm doing this for classroom or for teaching purposes. And now I'm going to turn my resident. The easiest way to turn a resident is by bending or crossing the leg nearest you, and then going and using the large joints, the hips and the shoulders, and the hip and the shoulder, and turn away from you. Just going to reposition my patient to make sure she's okay. Are you okay?
Double decision 6 sign.
I'm going to roll this pad in.
Appearance C, sign D.
I'm going to apply a new pad.
With the snowstorm appearance.
All right, making sure the pad starts off at the upper hip level. Push it through.
Numerous cystic spaces, the so-called honeycomb.
Trying to make sure there's no wrinkles in it, and now I'm going to lay my resident back down. Only for the state of Florida examination would you change the pad before you actually cleanse the resident. So that is what's required for you to pass the test. And our goal is for you to pass the test and not overthink the process. If you are tall enough, you can just simply unroll, take out the dirty, put it in laundry basket. Excuse me, the dirty, put it in the trash can.
Which finding confirms fetal viability in the first trimester.
Roll out the rest of your pad and then re-center your patient.
Detection of the fetal cardiac activity is the first.
I'm going to expose you a little and let me cover up your legs for warmth.
If there is no heart, so it means that fetus is not non-viable. So you have to be very
careful. So whenever you're cleaning a woman, you want to clean the outer folds of the labia, the opposite fold of the labia, and then go down the center. Because we're only cleaning a mannequin, technically it's already clean. So we're only going to do 3 wipes. But in the real world, you would wipe until your resident was 100% clean. So if you're at the test site, you want to have your nurse test the water temperature.
Which condition commonly produce the
if your water had gotten cold because it took you a while to change the pad, you may want to put this rail back up, cover your patient, and then go get fresh water. When you're preparing your washcloth, fold it into an eighth. So when I pick it up, it's already folded, so it's folded into a quarter. Pick it up and, fold it once more. And then every time you wipe, you just peel a layer.
So you have to
peel a layer and peel a layer. Every time you wipe a woman, you're supposed to use a different spot on the washcloth. So it'll make sense in a few moments.
The major difference is a pregnancy test should differentiate the two.
I'm going to wet my washcloth, wring it out very well. I don't want to have to change my new pad that I just placed, so I'm going to be drying my gloved hands on the towel that's on top of the table. For the state of Florida examination, we do not put soap directly in the basin. We apply 1 drop of soap to our washcloth. And I'm going to wipe the outer lip going down. Change positions, even though there's no soap on that part of the washcloth, because I put the 1 drop of soap, it counts for the entire washcloth. Don't overthink the process, just pass the test. And then I'm going to wipe down the center. So I cleanse by going down, front to back. I did one side, outer. I repeat the process on this side, outer, and then I'll wipe the center. And now I'm going to rinse the same exact way. Are you still doing okay? I'm almost done.
It doesn't pay off now, but if you keep
all right, so this is our rinsing cloth. I'm going to dry my hands so that my pads do not get wet. I'm going to find the corner that I'm going to be pulling down. And how do I wipe? You're correct.
Don't forget to leave comments and also subscribe and share the link to our channel so that others can also benefit. Thank you so much.
Center. Always wiping down. Whenever you get your new towel, don't let it touch you. And I'm going to dry the same exact way. I'm drying you now. Outer, outer, center. I'm going to reuse this towel for her rectum and her buttocks. I can now cover up the front of my resident. Okay, I'm going to have to turn you in order to clean the back of you, okay? We're going to turn. Remember what we did last time? You came towards me. I'm going to uncover your legs so it don't get caught. Make sure your arms out. Going to cross your leg. All right, now I'm going to turn you on the count of 3. 1, 2, 3. Get you repositioned. Get you off your arms. I'm going to cover her for warmth. Try to make sure your legs are not touching the bed. And now whenever I clean the resident, I'm going to still continue wiping from front to back, from cleanest towards the dirty area. I'm going to get another washcloth. So now I'm on my third washcloth. I'm going to wet it, wring it, dry off my hands. And remember, for the state of Florida examination, how much soap do we apply?
From the first moment I saw you,
if you said 1 pump, you are correct.
I knew I had to make you
mine. I just wipe the rectal area. I'm going to change spots.
Wanted to know everything about you.
Lift the washcloth. Wipe the
I didn't want to waste no time.
Every time we wipe, we see residue, so we would know if we were using
what's something I can do for you, darling?
Don't overthink it. Just remember to check your water temperature.
That would make
to make sure you don't
smile.
Wet that pad. To keep wiping in the correct direction.
I'll bring
and
you
wipe all the areas
flowers,
that you're
girl.
supposed to wipe for perineal care.
Enough to see for
you also have to communicate with the resident, and the nurse will answer on behalf of the resident.
Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours.
You could apply to your resident.
I love your style,
examination that is not a requirement.
and I love
Make sure
your
there's no wrinkles behind your patient. That even includes the gown. Okay, I'm going to lay you back now.
I love it when
we always want to keep our residents aligned. So you're going to reposition her back. Reposition her back into the bed. Straighten out her gown.
I didn't know
remove any wrinkles.
When I found you that I would find a love so true.
Take
and
off
you
gloves.
Can see it in my eyes.
I can then let this roll back up, lay my supplies, re-glove if I need to do any other procedures in the room.
Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours.
We have 2 towels in addition to a towel that's on the table. I prefer to put a towel on the table. That's not a requirement, but because this is this patient's eating surface, I want to keep it as clean as possible. So that's the purpose of the towel. I have a laundry bag. I also have a laundry basket, which you can't see. It's off camera. Some of your facilities will allow you to use wipes, others will not. So if you're able to use wipes, go ahead and do so. And then if I need to change the pad, I have an additional one. So this is a disposable pad. You may refer to it as a chucks, but beneath the patient right now is a reusable, it's a washable pad. So we'll see if it needs to be changed. And so whenever you're thinking about perinatal care, you're always thinking about preventing cross-contamination. So we want to start from the cleanest area and then work our way to the dirtiest area. So it's going to be front to back.
Other things you need to be mindful of are body mechanics, so making sure that your bed is up to a working height, which it is, and try not to work over rails. I've already gotten the patient's permission. I've raised the bed. I've washed my hands. I've gloved up. I've allowed him to check the water temperature. If, because of limitations with movement, he was unable to put his finger into the water and check the temperature, I would simply wet a washcloth and then drop some of the water from the washcloth onto his hand, and that would be a way that he can check the water temperature. One more thing that I want to encourage you to do is to encourage independence. So allow your patients to do as much as possible, even if it's not perfect. And so if they can move their extremities, allow them to maybe wash the penis, and then you would take care of the scrotum and the rectum. So here we go. Let us begin. Introduction's already been done. I'm just going to move this over a little bit. Mr. Lucas, how are you doing? Good. I'm going to lay you back. Is that okay? Yeah. And I know you heard me tell our audience that we were doing perineal care, but you may not know what that means. So perineal care is pretty much me cleaning your genitals, your private area. All right. Are you still comfortable? Good. And I like to communicate with my patients and let them know what I'm doing. All right, I'm pulling your cover down. You do not want to overexpose. Something that I prefer to do is to actually put a towel. So if you have a bath towel, that's wonderful. But if you have a towel, you can put that over their genitals. Let's say somebody walks in quickly and they didn't knock. The purpose of this towel is so that I could easily cover my patients. Sometimes family members, they're not medical professionals, so they're just going to do what they want to do, and they're going to come in fast, and I want to make sure that my patient is protected. So are you still doing okay? All right, great. I'm going to go ahead and open up your legs a little bit just so I can see. All right, so I'm doing my skin assessment at the same time. I'm looking at his penis. I'm looking for any drainage, also checking for discoloration, any different smells that may be abnormal. Whenever you are preparing your washcloth, you're going to, here's a washcloth that's open. Fold it, now it's halved. Fold it again, and now it's in quarters. And what I do is once I wet it, wring it, and apply my soap, every time I use a different area on the washcloth, I peel a corner back because we should not be using the same corners or the same spots on the washcloth twice. In addition to that, once you've used the washcloth, I forgot about my other item, my laundry bag. Once you've used the cloth, it should not go back into your water because we don't want to recontaminate my water. So we have that right there. Mr. Lucas, I'm going to go ahead and start, okay? Wet it. Wring it. Remember to keep it folded. I'm going to open up my soap. Right. Let me know if you feel any discomfort. I'm going to take the soapy part of my washcloth. I'm going to clean in a circular motion without using the same spot twice. So here we go, starting at the meatus or the tip of the penis. Go around and let's peel back. I know a lot of you all are saying, well, Eunice, you only had soap on one spot of washcloth. If you do put too much soap on your patient, that can cause dryness. And if I was, really concerned, I would just put soap on the next washcloth. So far, what I've washed or cleansed is the shaft of his penis. I've not washed his skin folds. I've also not washed his scrotum or his testicle area. You still doing okay? Good. I'm going to put some soap on. Make sure that now I'm going to complete that process. And if I get close to the rectal area, I pull back, get a new corner, get close to the rectal area, pull back, get a new corner. And now let me clean his testicles. Don't forget that as men age, their testicles are not nice and firm. They usually start hanging. And so you want to make sure you lift those testicles up because it could be some bacteria, some fecal matter that's beneath. And that's going to cause your male patients to be touching themselves because they're actually itchy. After I wash, I now have to rinse. You still doing okay? Good. All right, so we're going to rinse the same way we wash. We're going to start here at the tip. Try not to touch the bed. I'm going to go around the shaft. We have to remove that excess soap off. Going to go down and change. I flipped it, down and change. Get a new area. Rinse the testicles. And now I'm drying. Make sure you dry thoroughly. Don't leave any area wet because that would be an area where bacteria can grow or yeast can grow. Remember that yeast like areas that are dark and moist. And so I'm going to fold this because I'm going to reuse this towel because I used it after he was clean. All right, and so are you still doing okay? Great. Let's pull back your covers. All right. So that was the front part of the bath. Now I need to actually clean his rectum area. All right, let's get you to come closer. If my gloves were obviously contaminated, I will go ahead and change them out now. But so far, we're okay. If this was a patient who could move, I ask him to move himself toward me. Before you have a patient turn away from you, make sure that opposite rail is still up. So here we go. I'm going to help you come towards me. I'm going to get your shoulders first. Then I'm going to get your legs. We're going to go this way, okay? You have any pain right now? All right, we're going to turn 1, 2, and 3. All right, you're kind of creaky. Good. If you can hold on to the rail for me. Perfect. Let's not overexpose. Okay, so the towel that I previously had on his front, I'm going to use it to just put beneath him. That way, if any moisture drips, I won't have to change the pad because right now the pad is clean and dry. And make sure it's also wrinkle free. All right, so now that we have him on his side, we're checking on him to make sure he's okay. And so far, we're doing really good. Also, if you have your vital sign monitor, you can be looking at the heart rate, looking at the pulse ox, looking at the O2 saturation. That will help be an indicator also. I did a really good job cleaning from the front because I can see that there is, his testicle area. There is no stool or anything. But now that I have him on his side, I want to go from the cleanest area towards the dirtiest area. And if I need to re-clean those testicles, I could. All right, so we're going to go ahead and clean the rectum area. And so if we had to clean that area multiple times, we'd peel back and then clean again. For a mannequin, that's all he needs for his rectum area because he's not truly contaminated. For a patient, you would use as many washcloths or wipes as you need in order to make sure that their rectal area is clean. So after I clean the rectum, I clean the buttocks. We're going to go up. I'm going to switch back. Clean another area of the buttocks. So now buttocks are clean. Clean area on the washcloth. Clean up. And because I couldn't clean the entire buttock with that one stroke, I'm just going to pull back again and clean again. So make sure that whenever you're doing this, you have sufficient washcloths. I'd rather you bring too many washcloths in the room than not enough. Mr. Lucas, are you still doing okay? Great. I'm almost done. I'm going to rinse you now. And you all should be pros at this by now. So we rinse the same way that we washed. So we're going to go from crack to the back, change positions, rinse the buttock, complete rinsing that buttock, especially if they have a larger or a wider bottom area. Repeat that process here and repeat it again. We don't leave anybody wet. So we're going to dry. I'm going to pat his buttocks. This is a good time to do a skin assessment. So his skin folds, his skin was not impaired. Everything was intact. If your facility required you to put on ointment, you would put that ointment on. Now, usually on the coccyx area, sometimes, especially if they have excoriation, similar to like a baby rash, you would put that on, but you'd only do so if your facility or your nurse told you to do. So make sure you follow those policies. I'm going to wipe that off because this is just a mannequin. All right, make sure there's no wrinkles in your pad. Mr. Lucas, I'm going to help you lay back now. Going to discard of my gloves. Going to wash my hands or sanitize my hands. And now I can finish getting him repositioned. We like to leave our patients in the center of the bed. So the way that I move somebody who's unable to move themselves is I move their body in increments. So you do not want to pull a joint because you can dislocate that joint. So I'm going to support both shoulders. I'm going under and I'm moving him over. Reposition his pillow. Make sure his hips are aligned.
Ultrasound is not an exception. There are so
Check
many
his
illusions
feet. This will be a good time to elevate the feet if needed.
They are a product of illusions.
And because most patients do not enjoy laying flat, I'm sure you don't either, I'm going to make sure that I raise the head of his bed back to his tolerance. And if you cannot reach over the bed without touching the linens, you would need to walk around. So I'll walk around and finish the other side. But before I leave, I need to raise the side rail.
You can see the umbilical cord nicely there on the fetus. And you can see this is the umbilical artery waveform.
Right. Let me know when you're up high enough.
Very normal, low resistance umbilical artery, Doppler waveform that we
That's
have there.
good.
Yes, you can see there.
All right. Here's your call bell.
Look here, you can see.
Team, great job. So we have provided perineal care to Mr. Lucas. And so now you'd have to, of course, re-glove because you have to clean these supplies. And so you'd be emptying your water basin once you rinse it, and you can clean it with soap if that's what your facility requires. And we usually dry it. We don't want it air drying. So you're going to dry it out, and then you're going to take your laundry away. Right now we have a laundry basket. You can put everything there. Our bed is a safety issue because we raised our bed up to a working height. We need to lower that before we leave the patient. Don't forget to leave him with the call bell. See if he has any other needs before you exit the room. My side rails are up. Clean up your room. And don't forget to document. If there is something that you found that was concerning, you notify the nurse. And then in your documentation, you'd also put, what that concern was and that the nurse was notified. So I hope you learned a lot. All right. And so I look forward to seeing you in the next video.
So I've done the normal procedures. I've washed my hands. I'm donning gloves. I've provided privacy. I've explained the procedure to the patient. I've assembled my items and also gotten the bed in the position that I wanted in. Remember, with the catheter, you always want it flow independently and freely towards the foot, lower than the bladder. In the real world, there may be some type of securing device on the upper thigh. You may or may not have that during the Florida CNA examination. Okay? All right, so we've checked the water temperature. And now I want you to repeat after me. Wash, wash, rinse, rinse, dry, dry. Wash, wash, rinse, rinse, dry, dry. I folded my washcloth. I wrung it well. Make sure the nurse has already checked my water temperature. And if you remember from our previous videos, we fold our washcloths into a quarter and we peel back each time we wash. For the state of Florida examination, your water must always remain clean. You apply soap directly to a wet washcloth. Let's begin the washing process. Outer, center. Wipe down and change. Going to move your leg a little. Wipe down and change.
I like that view.
I'm going to wipe above the catheter. I'm going to change spots. I'm going to raise the catheter gently without tugging. I'm going to wipe the center beneath the catheter.
You can see
wash. You cannot wash, rinse, and dry the vagina with a dirty catheter. So it's going to be wash the vagina, followed by wash the catheter.
Please we must beat the
Remember, whenever we're cleaning a catheter, we don't want to tug. That's going to cause pain to our patient. So we're going to pinch at the insertion point. I'm going to start cleaning your catheter now. Talk to your patient as you perform the skills. I'm going to take this washcloth that has 1 drop of soap. I'm going to wrap it around, and I'm going to go down about 3 to 4 inches. I'm going to change positions.
In ultrasound in general, so most of the
I'm going to repeat that process for a total of 3 times.
At the apex of the heart, it looks like there's an opening. If you don't look
I'm trying to get as close as I can,
but you can see
without
that
tugging.
Blood is not spilling into
that
the
was
pericardial
wash.
space.
What's
Look
the
at
next
here,
steps?
look at
We're
here,
going to
the
have
heart
to
is
rinse
pumping.
and rinse. So we're going to get a
There's
new
an-
washcloth.
there's
Going to
an
wring
opening
it out.
which doesn't exist. Ladies and gentlemen,
And now we're going
the
to
problem
rinse
of
the
fetal
same way that we
echocardiography
washed.
is you are
Down,
dealing
change,
two moving targets.
down,
So the fetal itself is
change,
a moving target, and
above
also
the
heart is a
catheter,
moving target.
change,
So you are dealing with
gently
two
lift the
moving
catheter,
targets at the same
wipe
time.
down the
So
center.
you ideally have to examine.
Now, whenever you are rinsing your
knowing
catheter,
very well that
even though you had to
these
wash
things
it
are
3
moving,
times, you
the
only
fetus
have
might
to
not
rinse
be,
it once.
as
Before I
happening,
start
but you
rinsing,
must
what do I have to
be able
do?
to
If you said
see
security
anatomy,
catheter, you're absolutely correct.
nicely,
So I'm going to
because
security catheter. I'm going to
those who
pinch
did
it,
this, they
and I'm going
know,
to clean,
the
rinse
relative
down
motion,
about
the
3 to
proof
4
of
inches.
activity. So when
Awesome.
two
We can't
structures
leave our
motion,
resiness wet.
It can also
So
create
once we
atrophy. So you
have
can see the nice
washed and rinsed both the vagina and the catheter,
So
we're now
again,
going
what
to
I
dry.
was talking about, look
We're
at the
going
eyes,
to go down,
look at the mouth, the nose,
go
the
down,
upper lip, the lower lip.
go down.
This
If you
is
notice, I'm always changing
great
positions.
exercise.
Go down, and now whenever I
This is
dry, I'm going to pinch,
This is the uterine artery
pull
Doppler
down
there,
gently.
and that's the heart rate of the
For
baby.
the state of Florida
or the
examination,
fetus.
you would have placed a pad
So,
before
ladies and
catheter
gentlemen,
care,
what
and
I
at the
need
end of
you
your
to
skill,
do
you
is
have to
to
remove the pad.
master
In the real
ultrasound
world, usually there's
cardiology.
always pads
You
beneath
know-
your
you must know
patients.
the
However,
do's and
for the
don'ts of
test, don't
ultrasound.
forget,
You know the do's
catheter
and
care,
don'ts.
place the
means
pad,
your
and then
practice
remove it at
will
the
be
end.
you.
If you need to see how to place a pad,
filled
just
with
go back to our
hand
perineal
involved.
care
You
video,
enjoy,
and it will show
but
you how to
if
do so.
you
All
don't
right,
follow
everybody,
the
it's Nurse Eunice with Florida
protocols,
Training Academy. If you like this video, go ahead and give us a thumbs up, share it with a friend. Don't forget to subscribe to our channel. And if you're here in Jacksonville, Florida, or if you're in the Florida area, we provide hands-on CNA exam prep classes in 2 days, which are perfect for pre-med and pre-nursing students. All right, everybody, have a great day. Bye.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com.
In today's video, I'm going to be showing you how to put a resident on a bedpan. And for one of our demonstrations, Patrick is going to be able to assist by raising his hip. And the second demonstration, he's going to act as if he's unable to move. And then I'll show you how to put the bedpan under someone who needs more assistance. For your Florida CNA examination, it doesn't matter which technique you use. I usually advise our CNA students to use the easier technique because our pretend patients, when they're taking their CNA examination, should have the ability to raise and lower their hips. If I don't say it in each video, don't forget, I've already washed my hands, I've closed my curtain, and I've already gloved up. If I do not change my gloves for every step, do realize this is a training video. If you want to support us by sending us super thanks, that will allow us to provide more gloves and buy more gloves so that we can actually change gloves more frequently during our skills. We know that in the real world, you change your gloves and you would not be recontaminating other items. This will suffice for the Florida CNA exam. All right, no more disclaimers. Let's go ahead and get started. Patrick sitting up. I cannot put anything beneath someone if they're sitting on their bottom, so I'm going to lay him down.
Between obstetrics and the
You doing okay today, Patrick?
And they can create a lot of problems. So in this presentation, I'm going to discuss one of the marriage between gynecological and
I'm going to remove this call bell.
Challenges that are so confusing at times and misleading.
I'm going to raise up the corner of your sheets here.
So here, what you are seeing here
for the state of Florida examination, there will not be a pad beneath the resident. So you're going to prepare your pad. Remember that the plastic side will go towards the bed, just like a diaper if you're thinking about a baby. And the cotton side will go towards the skin. I'm going to roll this in halfway.
So the pain was
Remember,
very
for our
severe.
first skill,
Then
Patrick's going to be able to assist.
on
All right,
ultrasound,
so
you can see
Patrick,
that this is a
on the
fairly
count of
pregnant
3, can I
day.
get you
The
to
uterus there,
bend
you
your
can
knees,
see
number
here
1,
what we
bend
have
your
there.
knees, and then
That's
on the
our
count of 3, if you can
gestational
raise your
sac.
hips
You
up
can
as far
see
as
the
you
cyst
can.
there.
All right, 1,
And
2,
you can
3,
see
let's
this
go.
is the cyst there. It's extra.
Very
As
good.
you can
And you
see.
can lower.
So
now the pad is placed, and remember, I did not overexpose my resident.
existence
I can now go to the cabinet and retrieve the
an
bedpan.
ovarian mass or cyst or any extrauterine lesions can cause.
When you retrieve the bedpan, you also want to bring the toilet paper. For this skill, the patient would be able to wipe him or herself. Remember, in the real world, this would be something that the CNA would be doing if the patient was unable to assist. Don't overthink this. It's just for the test. Here's the toilet paper for you to use after you do urinating. Whenever you're placing the bedpan, you want to place it based upon the form and the shape of the bedpan. For a male, they sometimes have smaller bedpans, and then they also have urinals. But for the CNA examination, I want you to pretend that all of your residents are females. And because it wouldn't make sense to put this under Patrick if he was just simply urinating. We give him a urinal instead. But for your test, pretend that all of your partners are female and that you're putting a bedpan beneath them to collect their urine. All right, and so now from the side, on the count of 3, when I ask you to raise, please do so. 1, 2, 3, raise your hips.
Signs of pregnancy.
Very good, sir.
You also have
All right, you can lower your knees now.
Fetal or gestational sac. If those things are not there,
in the real world, you'd actually look between your resident's legs, make sure that you can actually see the bedpan, because if not, you can actually get more urine on your bed and complicate your skills. You'd actually have to then give the person a bath and change the bed linen. Now that I've given Patrick the toilet paper and the call bell, I want to raise the head of the bed so that he can really clear out his bowels or his bladder. For the standard fluid examination, you're putting somebody on the bedpan who's pretending to urinate. So this is not a skill in which you have to wipe them. It's just practice.
Obstacles. The uterus itself, pay attention to it, check it nicely to make sure that there are no other signs of
all right, and you're not going to take off your gloves for the Florida CNA examination. You're going to go behind the curtain for about 5 seconds, and whenever you're done, you'll come back and ask your resident if they have finished using the restroom.
So you can see how ultrasound is the greatest gift from many.
All right, Patrick, are you finished? All right, thank you so much. I'm going to take the call bell. If I can get you to keep holding on to the toilet paper until I have a place to store it.
It's very difficult to know.
You're now going to lower the head of the bed.
Of the pain. So, and then the fear will always creep you to say that maybe I'm about to miscarry. So for the good.
All right, Patrick, on the count of 3, can I get you to raise up for me? 1, 2, 3.
You must.
Thank you so much.
Be competent.
You can lower your knees. All right, so for a state of fluid examination, you'd of course put your disposable pad inside of the trash.
In an obstetric,
for the state of fluid examination, you go into the bathroom. You then empty your imaginary contents into the commode. In order to rinse the bedpan, you cannot touch the faucet with your gloved hands. So you're going to use a napkin to turn on the water. Get your rinse water into your bedpan and then pour the rinse water into the toilet. Turn off the water using a napkin. Now you're left with a wet bedpan. You'd have to then get a napkin to dry it out. And then whenever you're storing your bedpan, you cannot contaminate the cabinets.
For things like hydrosoppings,
you will take the napkin to open the cabinet.
If there's no inflammation, if there's no fluid within them,
store the bedpan.
If this
may I have the toilet paper?
Is collecting within them. So, but
store the toilet paper.
Regions around.
Your gloved hand cannot touch the cabinet.
Normally,
you would use that same napkin.
Fallopian tubes are not visible on ultrasound.
To close the cabinet.
They are visible when they are dilated.
You can now take off your gloves and wash your hands. However, there is one more step left to the skill. You have to ask the resident whether or not he wants to wash his or her hands. And I'm not an advocate of toting a used towelette with my bare hands. So in the real world, you can take off your gloves, wash your hands, put on new gloves. But for the state of Florida examination, you can go through the whole skill with one pair of gloves on. Remember, you're only simulating putting someone on top of a bedpan. They don't want you wasting supplies.
ultrasound scan, because you write your report today.
All right, Patrick, half of the washcloth is wet, half of it is dry. Would you go ahead and cleanse your hands and then dry your hands with the other half?
This patient is with a septate uterus, or this patient and diabetes.
Thank you so much.
Or they have a convert.
Put the used washcloth inside of the laundry basket.
So it is good.
Take off your gloves.
The best practitioner gives the referring.
Fix the bedding.
Answers to the problems that the patient will be presenting.
Give your resident the call bell to hold.
Thank you very much.
Would you like your head of the bed raised, Annie?
We keep learning, so we must understand that.
Reposition your patient.
Your pregnancy
for comfort.
We are not just ignoring the gynecological.
Lower the frame of the bed, wash your hands, and don't forget to open those privacy curtains. All right, everybody, this is Eunice Mathis with Florida Training Academy. Stay for a few more moments so we can show you how to put somebody on the bedpan who's unable to assist with the skill. So now I'm going to demonstrate how to put a resident on the bedpan who's unable to move. I do have the resident exposed for video purposes only. Of course, in the real world, you would not overexpose your resident. This video will not be showing the cleaning technique. Is literally showing you how to put someone who cannot move on a bedpan and then removing the bedpan. For our classroom purposes, the resident already has a pad beneath them. For your Florida CNA examination, you be responsible for placing the pad. One last reminder, you do not have to use this particular technique in order to put a patient on the bedpan when you're taking your CNA examination. You can use the easier technique, which is your resident raising his or her hips, you placing the pad in the bedpan, and then removing the items in the same technique or the same skill set. Now we're going to begin. I've lowered the head of the bed. We have our pad, and now I'm going to go to the cabinet and retrieve my items.
Then we'll see how.
All right, so I've lowered the head of the bed. We're going to go ahead and get started. I need to put our patient in a safe position. If I have him or her turn too much right now, they'd be too close to the edge of the bed. So I'm going to move him in increments and get him closer towards me. I'm going to use your shoulders. We're going to come up and towards me. Very good. I'm going to do the same with your hips and your legs. I'm going to cross the leg nearest me. I'm actually going to bend the knee, cross it over, and so now when I turn the resident, this knee is going to help him remain on his side. And something else I can do is just extend the forearm so that he doesn't roll on it. If your bed has rails, you can also ask the resident to hold onto the rail. On the count of three, I'm going to turn you, okay? 1, 2, 3. Very good. Smooth out any wrinkles. Your resident should not have wrinkles beneath them. And remember, he's exposed for video purposes only. You will not overexpose your resident in the real world.
And this move, we can see the
I'm going to use the napkins, open my cabinet.
The foot there and the toes nicely there, nicely demonstrated. Nicely demonstrated there. You can see the movements of the
I'm retrieving toilet paper and also the bedpan.
So you can
for this particular skill, since the resident can't help, I'm not going to give him or her the toilet paper. However, I do have it near me so that I can use it whenever we're done with the skill. Whenever you're placing your bedpan, find the larger collection area that usually goes towards the thigh. The very top of the bedpan goes at the top of the hip.
They are changing the position.
You want to push this under just a little bit. Make sure it's centered. On the count of 3, come back towards me. 1, 2, 3.
Here, this is the wall.
Get your hips on it.
This is the wall of the uterus. And now we are checking the.
Are you okay? I'll get you recentered in bed once we take the bedpan out. I'm going to raise the head of the bed to make going to the bathroom easier.
That's the spine of the baby. That's the heart. That's the heart that we have there. So that's the spine. You can see that the spine is okay. There are no spinal bifida or any abnormalities of the spine. As you can see there, you can see the heart. So here the baby is facing down.
Before you leave your resident's bedside, make sure you give them the call bell. Of course, put the sheets back up. But for video purposes, we're just going to lay the resident right back down and take out that bedpan.
The heart is within the chest of the baby. Now the baby is turned. Now it's facing up. You can see the eyes of the baby there. The eyes of the baby. You can see the eyes. Look at the eyes. This one.
Right, Patrick. I'm going to cross your leg.
The hands.
I'm going to secure this bedpan, and on the count of 3, I'm going to help you turn. Okay. 1, 2, 3.
Those are the hands.
Turn. Notice how I held this bedpan down. Had I not, it could have tilted, and I could have gotten some of the moisture, the wetness, whether it was in urine or fecal matter, on my resident. You would finish the cleaning process.
It's about to suck the thumb.
Let's go ahead and take it back.
It stopped. So you see here, it's a male, it's a boy. That's how we determine the
Remember, we're not going to overexpose our resident. He doesn't have to be perfectly neat right now. I can always come back and finish the process. Once I finish emptying the bedpan, I'm going to empty the imaginary contents into the toilet. I'm going to use a napkin to turn on the water faucet. I'm going to rinse the bedpan. I'm going to pour the contents into the toilet. I am now going to cut off the water. I can use a different napkin in order to dry out the bedpan. And don't forget that for the state of Florida CNA examination, you have to use a napkin if you have your gloves on whenever you're storing your items.
Within the heart of the baby, so there is blood flow in the heart of the baby. You can see.
Make sure you also offer to wipe the resident before the CNA exam. As long as you give them toilet paper, the person will pretend to wipe themselves.
Visualize the legs again. You can see they are straight. So this.
All right, so now I'm going to recenter my patient back into the bed. Pretend that I have taken off my gloves, washed my hands, and applied new gloves. I'm now going to reposition my patient in bed.
The abdomen.
So now I'm going to get you back centered, okay? If you can release the rail. I'm going to bring you over. 1, 2, 3.
There's the fetal stomach there.
Going to do the same for your hips. 1, 2, 3.
I think it's
and your legs. Let's get these legs aligned also. Sorry if I scratched you. That wasn't my intent.
Like we're cutting it.
Are you still doing okay? Want to get that wrinkle out the bedding.
There. That's where our spine is. So if you look,
you walk around.
You see that there are some movements. The baby is in a world of its own. The fetus is in a world of its own. So that's the heart. See the heart there. That's the waveform of the heart. Again, you can see here the thalami in the cavum pellucidum there. The thalami.
Hey Patrick, here's your call bill. Is there anything else I need for you right now?
Those are the landmarks that we use to
make sure you take off your gloves.
The biparietal diameter in our head circumference for the baby.
Wash your hands. If you lowered the side rail, you would raise it before you left your patient's bedside. If you brought the bed up to a working height, don't forget to lower it. Open up your privacy curtains, scan your room, making sure that everything has been cleaned and that the patient's right to comfort, safety, and privacy have been maintained. And if everything is done, you did a great job. All right, everybody, this is Eunice Mathis with Florida Training Academy. We look forward to seeing you in our next CNA training video. Bye-bye.
Again, these are the legs of the baby.
Hi, good morning. Miss Netta?
Those are the legs.
Hi, Miss Netta. My name is Eunice. I am your CNA today, and I'm here to give you a bath. Is that okay?
The foot is looking much better.
Before I begin, I'm going to go wash my hands. I'll be right back.
To the little there.
Hands are clean.
Wow.
Closing the privacy curtain.
Excited there.
Miss Netta, I'm going to take your toe bill, okay?
The toes. That's the toes. That's the foot. So you can see the toes. We can see the abnormalities on the foot as well. Okay. Both the feet are there. You can see it again. There it is. There it is. There it is. There
How are you feeling?
There it is. So I hope you are appreciating.
I hope you get cleaned up soon enough so that you can return to watching TV.
We are checking literally.
Because I have to wash your face, can I remove your glasses?
So it's an extra effort that you have to take.
And I'll give them right back to you after the bath is done.
Means certain pathologies. For some pathologies, they are life-threatening.
I'm lowering you. Let me know if you feel any discomfort.
So we need to know all those abnormalities. That's our placenta do. See, that's our placenta do.
Still doing okay?
That's the placenta do. That's the placenta do. That's the placenta. So you see the.
I'm not going to lay you totally flat because I know you were complaining of back pain earlier. Let me know if anything starts to hurt you.
So those are the fingers. So and the five. You see them again. See them again. See them again. Those are the fingers. That's the end there. That's the end. The radius and the ulna.
Is the temperature of the room okay?
There we have the hands, and you
I'm
can
going to
see
your
the joints. This is the spine, the neck. So you
and I already have the curtain closed.
And you see this is the face now of the baby. This is the lips. This is the nose. This is the nose. You can see
I'm
the nose
going to put a bath
the nose of the
blanket on top of you. Just to keep you a little bit warmer during our bath.
So
And for those of you all who are taking the CNA exam,
that's the upper lip,
if you do not have a bath blanket, you can use a towel.
That's the chin there.
This provides warmth.
If you look here,
and it also helps to dry your resident.
The upper lips, the upper lips, the upper lips there, the upper lips there, the upper lips.
Okay.
The upper lips there, the upper lips. You can see now. This is the whole length of the baby there. The whole length of the face. You can see the nasal bone, the eye. You can see the eyes there. You can see here. Okay, you can look at the eyes.
Raise your head just a little.
The eyes there. You can see the eye is wide open. These are the hands. See the eyes. See the eyes there. Look at the eyes. So here you can see how the baby is moving. You see how it is coiling itself. You see how it is enjoying itself in a world of its own. Look at that. This is amazing. This is creation. Look at how it is flexing itself. This is amazing. This is God's creation. You can see there. You can see this is the hippie bones, the placenta on color Doppler there. You can see that the baby or the fetus is enjoying the whole session.
I'm going to raise you just a little so that I can go ahead and move your
Look
gown.
at the face. Look at that. That's the face of the baby. This is the uterine artery. That's how we measure the right uterine artery to rule out preeclampsia. That's the uterine artery there. That's the uterine artery. That's the uterine artery. This is the other one. You can see how this is when it crosses the external iliac. So this is the cervix. So you see we are accessing the cervix. That is the bladder or the baby there. That's the bladder of the mother. Sorry. So ladies and gentlemen, this brings us to the end of this session. So you can see that the baby
Place this in the laundry basket.
The gestational age of 21 weeks and 4 days. The expected delivery is on the 20th of November.
So for the state of Florida CNA examination, you would have your nurse check the water temperature. She will act as the resident. In the real world, whenever you are putting water in your basin, if you already have your gloves on, you would allow some water to either run onto your wrist or you would do a taste here and the water feels fine.
We now have a
So Miss Netta, I need to put a towel on top of your pillow.
Update it time and again.
1, 2, 3, let's raise up.
See a lot of obstetrics, pregnancy sonars. We'll be uploading time and again. Thank you so
I'm
much.
also going to put a towel under the arm that I'll be
The
cleaning.
heart formulates the lifeline of the fetus.
For the state of Florida
So don't talk
examination,
about the heart.
a partial bed
We're not
bath,
doing anything.
you only
When it
clean
comes to
half of the
ultrasound
mannequin's body.
So now,
It's usually the upper
it is
half.
prudent.
That means you only have to clean one arm. We're going to clean the face,
in one way or the
the
other.
chest, the stomach, the
Localize the
arm,
heart.
turn our resident, and then
Know
clean
how
her
to
back.
measure the heart rate and have a basic understanding of
Wet it.
the anatomy of the heart, so that
Do not apply any soap to the
ascertain
face.
to make sure that the babies are alive.
Keep your water
Also,
basin
there are no
clean.
obvious
Don't
structural
reuse
problems that
washcloths.
can hinder the pregnancy.
So I'm going to
this
clean your
progression.
eye, starting from the inner
So here
area,
we put the heart
widen
there.
towards the
So
out.
that's the fetal heart.
Change
You can
spots.
see here.
Repeat
You
that
can see the fetal
process,
heart
inner
there.
to
That's the fetal
outer.
heart. That's the fetal
Change
heart. So you can
spots.
see this is the left
Now I'm going to
ventricle.
clean the rest of your
And
face.
then
How does that feel, Miss
you can
Netta?
see the right ventricle there. So you must know the structure of the heart for you to be able
Put
to
this in my
perform a very
laundry
good
basket. I'm going to use this towel here to dry you.
fetal heart
Inner reach over.
or echo. So you can see here, you can see the aorta there. That is the aorta
I'm going
there.
to pat dry
So
the
the
rest of your
Doppler, you
face.
can see
You
that
still
the
doing
flow
okay?
of blood inside the fetal heart. So you must be checking
For my second washcloth,
nicely
I
and
will
closely
apply
for
1
any
drop of soap.
structural defects, be it
1 drop of soap is all that is required for the Florida CNA examination. As a reminder, soap dries out the skin.
So you
So
see
1
from
drop of
Doppler,
soap
you can
is
see
all
the
you'll
arc of the
use.
aorta.
We'll
That's the
start here
aorta that
cleaning
is
your
going
neck.
there. And the
I am
blue
going
one,
to
that's
raise
if you have in a cover. So you must be very, very
the
meticulous.
bath towel to provide privacy.
Fetal
But
heart
for classroom
one of those
purposes,
things
so that
which is
you all
not
can
so
see what
obvious
I'm
and
doing,
not so easy
I'm going to
to
pull the bath towel
to
down.
do.
Okay, so
Not most
I
people are
started the
very
neck,
confident of doing
long
fetal
strokes
echoes.
down.
So
I'm going
ideally
to go
when
ahead
I'm
and
doing
clean
a
the
fetal
other
heart
half
or
of
a
the
fetal
chest
echo,
also.
If she had pendulous or breast that sag, I would lift the breast tissue and make sure that I clean beneath the breast also. I want to clean her abdominal area. Remember, just one drop of soap. I'm going to cover you back up now. Remember, I only exposed her for classroom purposes or for teaching purposes so that you all could see what I was doing beneath the towel. Cleaning her hand,
abnormalities or any defects.
Clean the back of her arm.
The other thing you must make sure
the
that
last part of the body that I'm going to clean is going to be her armpit.
This is the diaphragm there.
So a partial bed bath for the state of Florida exam is just the upper half of the resident.
So
now I'm going to rinse the same way that I washed.
That would be at an ectopic site, or what we call in ectopia cordis. So
I'm going to rinse
do
you
not
now.
just scan without
Try to be
localizing
mindful.
anatomy.
Do not allow your
Localizing
uniform
anatomy
to touch the
formulas
bedding.
one of the fundamental skills that you have to acquire when you want to be a competent sonographer or someone who
You still doing okay?
can be confident.
Notice every time I turn away from my resident, if the rail is down, I put my hand on my resident. And now so that you all can see what I'm
You can
doing.
zoom your heart nicely.
The towel that I had
and
placed
check
beneath her arm, I'm
all the
wrapping it
chambers.
over, and I'm going to gently
Remember,
pat
measuring the heart is not easy
the skin dry.
because we are
Whenever
looking at
I'm
two
drying
moving
the other
targets
areas,
that you have to beat. The fetus will be moving, the heart
around
also is
sensitive
moving.
areas, I can use the backs
So you
of
must
my
be very
hand.
vigilant,
Otherwise, it may feel like you're
very
groping the
patient,
resident. You still
Very
doing okay?
meticulous so that you don't miss.
Going to keep these towels and this bath blanket on you so that I can go ahead and keep you
Also,
warm. But now I have
during
to
that
turn
time
you.
when I check the
You
heart,
still
you
doing
have to check the
fine?
lungs
As I turn you, let me know
or
if
the
you
fetal
have any
chest
pain.
to see
To
if there
turn
are no
someone who's
structural
unable to
abnormalities.
move themselves,
So
I
this
need
is
to
the
go ahead and
continuation
get I'm going to lower the head of the bed a little
part
bit more.
of the fetal anatomy or anomaly assessment that I was talking about. So you must be very careful.
I'm going to grasp her
It's
shoulders,
very easy.
move her towards me,
I also do this.
do the same for her hips and
fetal
her
echo
legs. So now that she's closer to me,
Some
when
of
I
them
turn her, she won't be so
two-sided.
close to the edge.
And you
A technique that I like to utilize is
Obviously,
crossing the leg
overlook
over,
them.
and it'll make
And
sense in a few moments.
So
All right, so we're
I
going
need
to turn
you
you
to
on the count of 3, okay?
understand and
1,
appreciate the
2,
skills that you can use.
and 3.
You have a good resolution machine. Zoom the target area so that everything comes into picture. And you can do
Miss Netta, are you still doing okay?
so. I hope everything is making sense. I hope everything is making sense.
So now I need to place my next towel. And this towel is going to prevent
If you have good questions
the
or
bag
you
from getting
machine
wet when I cleanse the
that
back.
you don't trust,
You can
some
pull
people,
this
they
back
find
some because for this
their
skill,
own machines.
we don't have to clean her
don't trust your
rectum
own
or her
machine.
buttocks. It was the front
it is
and
very
her back.
pertinent
The state of Florida
that
or the
you
parametric CNA
can
examination
consult me,
has another skill
and I will
called
show you how
perineal
to
care,
best
and that's when you clean your
utilize your
resident's
machine to
genitals.
get
So
the best
now that I have my towel
results.
and I've provided privacy by covering
hope
up areas that I will
you are
not be
learning.
cleaning, I'm going to
I
go
hope
ahead and
You are taking
wet
notes.
my next washcloth.
So let's meet again in the next episode of our
Wring
learning
it out
series.
well so it doesn't drip
Thank
on
you
the
so
bed, and apply 1 drop of soap. And ignore these tubes. Miss Netta is a training mannequin that allows us to take blood pressures. She also has respiratory sounds. So some of the tubes, wiring, and attachments that you see here, of course, they wouldn't be on a regular patient, but they're on Miss Netta. And she helps us train our CNAs.
I'm going to
And
show
Miss
you
Netta was donated to us
how
by Jacksonville University, JU, who has a wonderful nursing program. So if you're interested in going further in CNA, we
this
highly
is another
recommend
of
that you research
gender
Jacksonville
discrimination
University.
when
And
you're
again,
doing
thank
your
you for the
second
donations,
trimester or
JU.
another
Miss Natalie, you still doing okay?
fetal distribution is the ultrasound.
Good.
So I'm going to show you
So now that I've washed the
how
back,
it appear like
my 5th and
on
last
the
washcloth, I'm going to
4D
use
and
to rinse
also
the
on
back.
the 2D, the
Oh,
standard
yeah, I know
mode
that
that
has to feel good.
you do.
We're almost done.
Let's start.
So now that we've washed and rinsed,
so you can see here, what you are seeing here, those are the testicles. You can see the balls there. You can see the balls there. Those are the balls there. These are the fetal
and then for the state of Florida CNA examination,
the balls there, the testicles there, the testicles. So this is the septum.
We apply
that is
motion to the back.
Like
we perform a back massage.
These are the testicles. The fetal bumps, the bumps,
circular motions. And the reason that you perform circular motions
so you can see
is to improve circulation. And plus, she's been laying on her back. So, in another of our videos, we'll show you how to reposition your residents.
So now, when you can see, look at the feet also.
And we have to remove that excess lotion. We want to provide the back massage, but we don't want to leave a wet area that can cause a pressure sore form. So I'm going to remove my towel.
And you can see
make sure there's no wrinkles beneath your patient as you lay her back. So I'm going to expose you just for a moment so I can lay you back. Get your reposition in the bed. You still doing okay?
The spine is the back. So these are part of the skills, guys, you have to understand or master.
So if you notice on my table, I have more towels and supplies than I needed. But I'd rather you have more than less.
Very excited.
If you are using
if you master how
a
to
back
identify
blanket,
the gender,
you won't need as many towels.
That's the penis there and the testicles. So these are the 2D acquisition. That's our 2D acquisition.
But I usually start off with 5 towels and 5 washcloths. Or if I'm using a back blanket, I would have 4 towels, and one of my towels is on the table, of course. And then in addition to that, I'd have my 5 washcloths. Miss Ned, I'm going to let this roll up. I have to get you down. I can sit you just a little bit.
Gender is very much well demonstrated, well displayed. No two ways about that. So some of the things that make you guys lose credit as a practitioner is when you falsify things. This is the bladder of the fetus. So if you tell your patient or a patient that the opposite gender, and then when they deliver, they can come back to you or they discredit your practice. So you must make sure that you do your homework properly before you divulge the gender. So these are some of the emotional moments that an expecting couple can go through the first time the gender is revealed to them. Some they can be very much excited that they stayed for long without a boy fetus, and finally the heavens are smiling on us. But some could be saying, I already have.
Also placing that in laundry basket.
Now this is the 8th boy. We've been trying to make a girl ever since.
Do you remember from last time? So I'll sit you up just a little bit so that I can tie her down in the back.
It's a lightly thing. It forms one of the fundamental fabrics of obstetric gynecology imaging. So if you know how to distinguish or to differentiate,
make sure you're not on any wrinkles.
In the feet, in the male, female, and the male gender on ultrasound. That is a good step in career development.
Oh no, I won't forget to put your glasses back.
Building your own.
You need to watch a TV show. I haven't forgotten.
Reputations to protect as practitioners above and beyond doing justice to the patients who are paying us their monies. I want you to look here, guys. You see this one. The cord is coming closer to the scrotum. So these are some of the misleading things. The way gender will be mistaken. You see this cord. You don't look close to the vagina of the brain. And you're going to see that this is a girl. So I recommend that when you're doing your verification of the gender, try to do it in a different place. This is the bladder for baby.
Here's your call now. Is there anything else that you need at this time?
The scrotum. So I need you guys.
I'll make sure I come back and check on you in about an hour, okay?
When it comes to fetal gender determination, make sure that these are the little things that can actually destroy your reputation for a very long time, if not for the rest of your career, especially when you are living in a community knows you where you are known. So you've got a reputation to protect.
All right, so my side rolls up. My bed is now lowered.
That this is the person who missed the gender and they made me to buy the clothes for the girl or for the boy. So don't embarrass yourself.
Pour out my water.
Take your time. So you see I've used these 2 modes. I have confirmed in both 2D and 4D that indeed it's a boy. So this is continuation of a fetal anomaly scan. If you do that, you complement the anomaly scan on the
So for the state of float examination, we don't store wet equipment or supplies. So I'm going to, I've rinsed it. I'm now going to dry it.
I was that I was born with 3 sisters. I'm the only boy.
If your items are stored in a cabinet, you have to use a napkin to open the cabinet. And now for the remaining items that you have,
family representative, the next
you can ask your nurse if she wants you to put those back into the supply area. But I'm just going to show you what we do in the real world.
So
take everything, roll it away from you,
seriously,
put it in the laundry basket.
So that we do justice to the community or the communities we serve in our respective.
There's your table, Miss Netta.
I thank you very much. Don't forget to share this educational content and also subscribe to our channel. Invite your friends also to watch our channel. Thank you so much. Enjoy the rest of your day. Hello, ladies and gentlemen, welcome back to Medical
Now
Ultrasound.
I take off my gloves like so.
Today we are going to talk
pinch from the
about
palm and pull down.
critical
Pitch and pull
medicine.
Off.
We are going to talk about
contain it. Your second glove, go under with 2 fingers.
The cerebral artery, as you can see here, is a branch of the sacrophyllus. This is the sacrophyllus that you are seeing there.
Go and wash your hands.
This is the sacrophyllus that you are seeing there. That's the sacrophyllus.
Open your privacy curtain. If you have to document, your nurse will give you a documentation form. And that was partial bed bath for the prometric CNA examination. Again, this is Nurse Eunice with Florida Training Academy. I wish you much success. If you want to see more videos, we have an entire playlist, and we also have an online CNA exam prep course. And right now, you can get 50% off that course by using the promo code SPRING2024. Go to nurseeunice.com. I'll make sure I have that information in the description area. All right, everybody. All right. Have a wonderful day. And we will see you in the next video. Say bye, Miss Netta. Bye, y'all.
Good afternoon, Mrs. Jenkins. My name is Eunice. I'm your CNA today. I'm here to put on your compression hose. I'm going to begin by exposing your leg. I've already washed my hands and pulled your curtain for privacy.
One of those type of cells that can not regenerate once they die. So the brain sparing effect is there for preservation. So we want to preserve the continuity of life. So that's why you see that the sacrophyllus is very critical. So when you're doing an ultrasound scan, you must be in a position to identify the sacrophyllus, and then you can sample the middle cerebral artery. So if you get this nice image at the level of the sphenoid bone, it will be very good for you to sample the middle cerebral artery nice like this. That's the middle cerebral artery. So you see the waveform there. So it's a high resistance waveform, as you can see there. So that's why you have put a deep notch there.
Ms. Jenkins, I just want to make sure that your stockings are free of wrinkles.
Then what's going to happen is there's going to be a high resistance, so the end-diastolic velocity, it is going to be very high. So this is very, very important. What you also see here, I've just also included the 4-chamber.
I am now going to lower your bed, wash my hands. You have your call bells or anything else I can do for you? Okay, I'm going to open the curtain. You have a great day.
Are you getting ready for the CNA examination? If so, don't study alone. Study smarter with Nurse Eunice. That's right. At nurseeunice.com, you can download free study guides and practice tests to boost your confidence. And when you're ready to take it to the next level, grab your CNA exam prep workbook, available at booksbyeunice.com or nurseeunice.com. Thousands of future CNAs have already used Nurse Eunice's resources to pass on the first try. Now it's your turn. Visit nurseeunice.com today. Train, learn, and succeed.
Signals so that I don't miss the middle cerebral artery. So when assembling
Final
this,
reminder before the practice test.
make sure that you
whenever you're performing CPR, you focus on high-quality CPR.
So you
that
don't
means
need
compressing deep, compressing fast. Remember, we're compressing at least 100 to 120 beats per minute. And then as far as your depth, it is going to be 2 to 2.4 inches for adults, 2 inches for children, and 1.5 inches for infants. You also have to know your ratios and terminology. If you're a single rescuer, for all ages, it's 30 compressions to 2 breaths. For children and infants, if there are 2 or more rescuers, it's going to be 15 to 2. Use the current American Heart Association standards and then read questions carefully. Testing language matters. So the terms that we use, ROS, AED, familiarize yourself with those because you're going to see those again in your actual class. Remember, you're not just memorizing information. You're preparing to save lives. At Florida Training Academy, we have been providing provider and instructor level courses for over a decade. If you'd like more information, you can go to our website, which is fltraining.com, or you can scan the QR code that is on the screen. Let's start with our practice questions. Question number 1. According to the 2025 AHA guidelines, what is the recommended sequence for relieving severe foreign body airway obstruction or choking in a responsive adult? Is it A, abdominal thrust only until the object is expelled? B, 5 back blows followed by 5 abdominal thrusts? C, chest thrust only? Or D, blind finger sweep followed by rescue breaths?
It is incomplete to do in ultrasound scan.
Revealing the answer in 3, 2, and 1.
To rule out
according to the newest guidelines, the answer is B. 5 back blows followed by 5 abdominal thrusts. The 2025 AHA guidelines now recommend a cycle of 5 back blows followed by 5 abdominal thrusts for adults and children, aligning with the ill core recommendations to increase effectiveness.
Very critical.
And here's an illustration. You want to support the choking victim. You're going to hit them in the back 5 times. 1, 2, 3, 4, 5. And then lower your hands. You're going to be about an inch above their belly button, and you're going to give 5 abdominal thrusts. You're going to do upward and inward thrust. And you continue that until the object is expelled or until the person becomes unresponsive. If they become unresponsive, you would lower them to the floor. Of course, you're calling for help. You would begin CPR, which begins with chest compression.
The waveform is very nice, and you can see
Question 2. You are performing high-quality CPR on an adult victim.
So,
what is the correct compression rate? Is it A, 100 to 120 compressions per minute? B, 80 to 100 compressions per minute? C, 120 to 140 compressions per minute? Or D, as fast as possible?
Hello, good people. How are you? So today we have a case.
And this practice test has 50 questions, so you're going to be overly prepared for your basic life support examination.
So I need you to pay particular attention.
If you chose A, you're absolutely correct. The recommended compression rate for victims of all ages is 100 to 120 beats per minute to maximize cardiac output.
The echogenic fetal pulse.
Question 3. What is the correct compression depth for an adult victim? Is it A, approximately 3 inches? B, at least 1 inch? C, 1/3 the depth of the chest? Or D, at least 2 inches, 5 centimeters, but no more than 2.4 inches, which is 6 centimeters.
That is called echogenic fetal pulse. And then it will be a normal value.
All right, and for this one,
sometimes it can be.
If you gave me one of 2 answers, I will take them. So I will accept C and D. Right. So for this one, I have D, but you can compress the chest 1/3 the depth.
A normal variant.
Here's the rationale for D: at least 2 inches, but no more than 2.4 inches. Compression depth must be deep enough to generate blood flow, but not so deep that it causes injury. So the standard is at least 2 inches or 5 centimeters. Question 4. When using an AED on a victim with a hairy chest, the pads fail to stick. What is the best immediate action? A. Press down firmly on the pads and hold them during the shock. B. Place the pads over the victim's clothes. C. Use the razor in the AED kit to quickly shave the area. Or D. Move the pads to the stomach.
You must always comment on that. Do not ignore it. It can also imply that there is an intra-amniotic bleeding.
Revealing the answer
especially if the mother
in 3, 2, and
bleeding.
Yes, it is C. Great job. You're going to use the razor in the AED kit to quickly shave the area.
Like that.
Good contact is essential for analysis and shock delivery. Shaving the placement area ensures the pads adhere to the skin. And if it's taking you too long, you don't have a razor in your AED kit, continue chest compressions. When in doubt, go back to your chest compressions.
That's not my main focus or my
Question
main challenge
5.
for the day.
You find an unresponsive victim with no pulse and no breathing.
That is coming.
After activating the emergency response system, what is your next action?
What we have here.
Is it A, start chest compressions immediately? B, give 2 rescue breaths? C, check for a pulse again? Or D, apply
It appears like
oxygen?
it's coming from the fetal head. Look at it. That item there. That item there. What is that? So it looks like
Great job, team. You have the correct answer. Yes. When the victim has no pulse and no breathing, and you've already called 911, or you've activated that code button to get rapid response in the room, you're going to do A. You are starting chest compressions immediately. The CAB, compressions, airway breathing sequence, prioritizes early compressions to circulate oxygenated blood. Question 6. What is the compression to ventilation ratio for a single respirator performing CPR on a 5-year-old child? Is it A, 15 to 2, B, 10 to 1, C, continuous compressions without breaths, or D, 30 to 2?
Cyst. So this is a placental cyst. You can see there. The fetal head is here, and you can appreciate it there. So if you rush this,
you have it. That is correct. The answer is D, 30 to 2. For a single rescuer, the ratio is always 30 to 2, regardless of the victim's age. That is, unless the victim has an advanced stairway. And during your BLS class, your instructor will tell you about that. Question 7. Which of the following describes the correct hand placement for infant CPR, one rescuer? Is it A, 2 hands on the center of the chest? B, 2 fingers in the center of the chest, just below the nipple line? C, 1 hand on the upper chest? Or D, 2 thumbs encircling the chest?
If you are not careful, you are going to mistake this one for a hygroma, or you are going to mistake this one for an encephalocele. But
I know this was tricky
it looks like
because
it's coming
the
from the fetal
AHA just
brain.
changed the guidelines.
Look at, you see?
So for this one, the
How it
answer is
appearing
not
like
B.
It looks
The
like
answer
here you
is
can
D,
nicely see that
2
it's
thumbs
originating
encircling the chest.
from the placenta.
According to the 2025
there's some solid
updates,
internal
the
components
2-finger
there. Maybe it's
technique
just some
has been
hemorrhage,
eliminated
just
because
inside.
research showed it
looks like
often
fibrin
fails to
strands, so
achieve
this could just
adequate
be
compression
a
depth.
normal hemorrhage.
While the heel of one hand technique is a valid alternative if you cannot
you can
physically
see that there's some
encircle the
internal
infant,
echoes as
think of
well,
somebody who has
inside
arthritis.
there.
The hand placement must be on the center of the chest,
So internal
not
echoes
the
in the
upper
amniotic fluid,
half
they
of the chest.
symbolize,
And so, 2-thumb
symbolize
encircling
the
hand
excasiosa,
technique is
which
the
is the
new
skin
way that
peeling
you
from the
perform,
fetus.
whether it's single
So
rescuer or
those are some of the
2-rescuer
things
CPR.
that
And
we have to
here is an
make peace with. If
example.
you don't make peace with these things, they are going to haunt you in your practice of medical ultrasound. So fetal
Question
ultrasound
8.
is one of those
When
things
performing 2-rescuer
where you're
CPR
able
on
to
an
look at a
infant,
lot
what
of
is the
issues,
recommended
a lot of
compression to
issues.
ventilation
You
ratio?
must carefully
I
look
know,
at the
how
placenta.
scary.
You also have to
Is it
look
A,
at
30 to 2,
the
B, 5 to 1,
attachment
C,
of the placenta
15 to
itself.
2,
Is it
or D, 50 to
all
2?
coupled? Is Is it not a placenta abruption? Those are some of
That's
the
right. I
things.
can't trick
The
you. We've
attachment of
covered
the
it. And yes,
umbilical
you have
cord
the
as
correct
well.
answer.
You
It is
must
C,
see
15 to
is
2.
it attaching at
When
the
a
correct
single
position.
rescuer is available for children and infants,
So
the
the
ratio
umbilical
changes
cord
to 15 to
itself,
2 to provide more
if it is not
frequent
thickened,
ventilation. Great job,
so there's a
team.
lot of work that is
Question
involved. There's a
9.
lot of work
How
that is involved.
often should
So I
rescuers
don't need you
switch roles
to rush
during
these
CPR
things.
to
You
prevent
see, the
fatigue?
placenta is attaching
Is
here
it A,
just
every
adjacent
5
to them.
minutes? B, only when the compressor says they are tired? C, after every shock delivered by the AED? Or D, every 2 minutes
Initially,
or
when I saw
after
this, I was
5
thinking that maybe
cycles of
it's
30 to 2?
encephalocele, but after due diligence,
I
you
know,
can see
this
that
one's
it's not
tricky.
originating from there,
This one's tricky.
from the fetus. So,
But
ladies and
yes,
gentlemen,
you have it. It is D.
I thank you so much.
Every
If you
2
are paying
minutes or
particular
after
attention
5 cycles of
to
30 to
this
2.
neat and smart
If
detail,
you only
otherwise we are going
switch
to be very, very
after
horrible
an
practitioners.
AED delivers a
Don't
shock,
forget to
what if the
turn on
person's
the
in a
notification button,
systole and the
and then
AED
also
never
subscribe to our
indicates
channel.
that a shock is
Let's
required?
keep on growing
So
the
that's
community
why
so
C
that
is not the
we
correct
get
response.
engaged. If we
The
grow
correct
big,
response
it
is
means
D.
a lot of people are
Switching
going to
every
come
2
up
minutes
with different
ensures
ideas, then we
compressions
can
remain
plan
high
from more angles. If
quality
you have got
and the
any
compressor does not
questions, feel
become
free to get in touch
exhausted.
with me. My name is Last.
Question
Then I
10.
can assist
What
you
is the
in any
maximum
capacity.
amount of
You can
time
type the
you
comments
should
in the
take to
comment
check
section.
for
You
a
can also
pulse?
check for
Is
my
it A,
email
5
and the
seconds,
website.
B, 10
Last,
seconds,
it's
C, 30 seconds, or
last
D, 15 seconds?
chitumba@outlook.com. Then you can send me a message. Thank you so much.
Sometimes there's a
Perfect.
war.
Yes,
there's
it is
conflict
10
between
seconds. So the
religion
answer is B.
and science.
Pulse checks should be at
Spirituality
least 10
and
seconds,
science.
but no
They-
more than,
they
should be at least
conflict at
5
times.
seconds,
That
but no
brings a
more
lot
than
of
10
challenges
seconds to
to the
minimize
practice of
interruptions in
medicine in
CPR.
general.
So for
It
those
also
people who are on the
brings
rapid
challenges to
response
the
team,
practice
those
of medical
advanced
ultrasound.
rescuers,
So, let
they
me
can do
present
a
to you one
quick
of these
pulse
emotional
check,
cases
5 seconds,
that
get back
I
on the
did
chest.
at my
But in your
department.
classes, we allow
So we
you
were
up
this
to
couple.
10
So
seconds
this
because,
couple,
again,
they
this is
they
basic
wanted
life
a
support.
girl
We
child.
have to
They've
give you an
got
opportunity to learn what you're doing
6
and to
boys
grow
already. So
in
they're
your
looking for a
clinical
girl.
and your critical thinking
So they
abilities.
went to church. So
Question 11. In
their
the 2025
their prophet, they
guidelines,
said, now
where does
this
the
is
administration of naloxone
this one
fit
is
into the
it's a
BLS
girl,
sequence
so
for a
that
suspected
attachment.
opioid
And they
overdose?
came to
So in other
Arizona
words, when do we
with
administer
that
Narcan?
hype,
Is it
very
A,
excited
give
about everything that
naloxone
was going
before
on.
starting CPR?
The
B,
expectation
wait
of
until
having
EMS
a
arrives to
girl
give
child
naloxone?
for the first time in
C,
their
give
life.
naloxone as
It was
soon as
very
it is
temperamental.
available,
They were
but
very,
do
very
not
excited.
delay high quality
So,
CPR? Or D, do not give
science
naloxone if the patient
and
has
spirituality
no
at times,
pulse.
they conflict or they do fight. So now, I did the sauna, and this baby, he didn't want to hide anything. So they were very much convinced.
You have it. It is
what
C.
the men of
Give
God said.
naloxone as soon as it
So
is
now,
available.
Let's
Do
review the
not
agenda together.
delay high quality
And then you
CPR.
can share the
Naloxone is
emotion
crucial for opioid reversal, but it
appreciate
should
what
not
this
delay
couple
the
went through.
start
You
or
see, these are the
continuation of
testicles.
chest compressions.
And this is the penis there. So even a novice of medical ultrasound can easily tell that these are the balls and this is the penis.
Question 12. You witness a
those are the
9-year-old
emotional
child
moments when you have to
collapse
tell
suddenly. You are
your
alone.
patients
What
contrary
is
to
your
what they
first
believe in
action?
or to what
A,
they
perform 2 minutes of
think is the
CPR, then
reality.
call 911.
You've got spiritual
B, give
attachment
2
to
rescue
what the men
breaths
of God
immediately.
told them. So you see,
C, check
and
for
it's
a
a
pulse
boy,
for 30
it's a boy.
seconds.
So
D, leave the child to
I don't know, guys,
activate the emergency
in your
response
departments,
system
do
and
you
get an AED.
also encounter such type of emotional experiences where a patient already has got a predetermined
The
outcome
correct
of
response is
everything.
D.
Then what they
Leave the
need from
child
you is
to
just for you
activate the
rubber
emergency
stamping
response
that
system and to get an
whatever
AED. For a witnessed
they have,
sudden
whatever they
collapse,
found it.
the cause
So
is likely
this is
cardiac.
one of those
Immediate
cases.
defibrillation
So
is the
we were
priority,
now
so you
in
should
conflict.
activate the system and
And to
get
say,
the
you guys,
AED
look at
first.
that, this is a boy, They denied. They were denying it.
13.
I had
Which
to,
pulse site do you check
I
for
had
an
to
infant?
to show
Is it
them
A,
images
carotid,
from elsewhere to convince
B,
them, see the total
brachial,
sign. This was called.
C,
And I had to take them
radial,
through the
or
whole
D,
session,
femoral?
but they were getting disinterested, disengaged. They were disengaged.
And we'll give you about 3 seconds to enter your answers in the chat.
Conversation. So beyond and
the pulse site for an infant is going to be the brachial pulse, which is located on the inside of the upper arm and is the standard check site for infants. Remember that infants, their heads are larger than their necks, so it's going to be really hard for you to feel, to palpate a carotid pulse on an infant. Thus, we check the brachial pulse instead.
That comes with the
14. What is the primary purpose of allowing complete chest recoil between compressions? A, to allow the heart to refill with blood. B, to reduce rib fractures. C, to verify the patient is breathing. D, to rest the rescuer's hands.
Their main focus was just for they wanted me to just rubber stamp. Everything else to them, it was not important. It was irrelevant.
If you selected A, you are absolutely correct. Incomplete recoil prevents the heart chambers from refilling. So that means always having your hand on the chest. What you're going to hear us say in your BLS class,
if you were in my shoes,
is that you're going to hover. So you're going to raise your hands off the chest whenever it's time for rescuer number 2 to administer the breaths. So let me repeat that rationale. Incomplete recoil prevents the heart chambers from refilling, significantly reducing the blood ejected during the next compression. So you press down, you allow the chest to fully recoil to rise back up, and then also whenever rescuer number 2 is giving breaths, you take your hands off the chest altogether. Question 15.
Give the man the credit that he deserves.
You are providing rescue breathing for an adult with a pulse. What is the correct rate? Is it A, 1 breath every 3 seconds, B, 1 breath every 10 seconds, C, 1 breath every 6 seconds, or D, 2 breaths every 5 seconds?
The daily attritions and abrasions of you searching.
All right, let's think this through.
Identifying
we have
writing the report.
Adult patient who's experiencing anaphylaxis, their airway has closed, they have stopped breathing.
The disclosure of certain
we're trying our best to give them breaths using a back mask device. How frequently do we give a breath?
How do they value? Do they
I know this was tricky. So the answer is C.
Know what it's doing,
the guideline recommends 1 breath every 6 seconds, or approximately 10 breaths per minute for adults in respiratory arrest. Okay? And so if a patient is intubated or if they have an advanced airway and they're an adult, it's the same exact frequency. You give 1 breath every 6 seconds. It's no longer a ratio of 5 to 6 seconds. 16. When performing CPR on a pregnant woman, what modification is recommended if possible? A, perform compressions on the back. B, stop compressions and focus on ventilation. C, manually displace the uterus to the patient's left side. D, use abdominal thrust instead of chest compressions.
Obvious, but no, those are not obvious. But you know what? I had to go the hard way to show them the images, explain what it means to them. We explain that
this would be so scary to have to, but according to the American Heart Association, if possible, you would do C.
What is done to them.
You would manually displace the uterus, mom's stomach, to the left side. So left lateral uterine displacement release pressure on the inferior vena cava, thus improving blood return to
this baby to be born.
The heart during CPR. If you are not an advanced provider, if you're not someone who has been trained to do so, you focus on those high-quality chest compressions. And when the paramedics, when the ambulance comes, when the rapid response team comes, they are the ones who can displace the abdomen. So if you're afraid to do so, if you don't have enough rescuers, remember, chest compressions are more important if you're a single rescuer than you trying to manually displace the uterus.
Thank you so much.
Hello everyone, how are you doing?
here we've got a case in a first trimester fetus.
Question 17. An AED advises no shock advised.
So what we have
what
here,
is your next immediate step?
The fetus.
A, check for a pulse.
Of the fetus,
B, wait for the AED to reanalyze.
So this is
C, give 2 rescue breaths. Or D, resume chest compressions immediately.
Outside intestate, you can see the bowels there. They are outside there. So
an AED advises no shock advised. What do? You're going to do D. You're going to resume those chest compressions because the AED has already analyzed the heart, which is why it said no shock.
Fluid collection in the back of the neck, as you can see there. So look nicely there. You can see
have to go back and do a pulse
intestines, which are
after the AED has done its analysis. Say no shock
outside, as you can see.
If no shock is advised, the rhythm is likely asystole. Remember that flat line that cannot be treated with energy? Or it is PEA, which is pulseless electrical activity. That means that the heart still has electrical activity, but maybe there's something else going wrong, such as the patient has fluid built up around their heart, or maybe they are victim of some type of traumatic event where there was substantial blood loss. And while the heart is pumping, there's nothing
look at this
flowing through the heart because they've lost so much blood.
That's a giant umbilical cord cyst.
Say no shock advised. It's because maybe this person has a perfusing rhythm. Remember, your basic life support, you are not advanced life support. So a perfusing rhythm could mean that this patient who was previously in ventricular fibrillation now has a heart rate of 20.
In our case,
you all, that's not enough to sustain life. So whenever the AED says no shock advised, you put your hands back on that chest and you keep compressing until you see obvious signs of life. Remember, you're just the first link in the chain of survival. When those other rescuers come, they have more medications, they have more training, and they can actually stop the efforts, put leads on, and see what rhythm your patient's in. You can't do all that as a BLS provider. Okay? That was a lot to say, but you must resume CPR immediately to lesion. So keep your hands on the chest until someone with more experience tells you to stop. 18. What is the correct depth of chest compression for a child? Is it A, at least 2.5 inches, B, at least 1/3 the AP, which stands for anterior posterior diameter of the chest, which is about 2 inches or 5 centimeters? Would it be C, approximately 1.5 inches or 4 centimeters, or D, only 1 inch? And if you're enjoying this practice class and you haven't liked the video or subscribed to our channels, please go ahead and do so. We appreciate you. Adult CPR and child CPR have many similarities. And one of the similarities is going to be the depth. So the answer is B. Yes, it's still 1/3 or about
the movements. That's the heart.
2 inches.
The brain,
so that
the
is the
brains,
correct standard for or older. And what we like to say for the ranges for a child would be age to a stage. So it would be from 1 to puberty. And puberty would be signs of adulthood, such as breast development, or if you have a very large child who is an adult weight and adult height, you're going to go ahead and treat them like an adult regardless.
In the fluid field like that.
Question 19. For an unresponsive infant with a severe airway obstruction, what is the correct action? A, blind finger sweep. B, 5 back blows and 5 chest thrusts. C, abdominal thrust, or D, start CPR immediately.
The value of the first trimester scan.
We have an unresponsive infant with a severe airway obstruction. They choked.
Anatomical abnormalities or congenital anomalies.
Here's your hint so you can rethink your answer.
See the cyst there.
Anytime a choking victim becomes unresponsive,
what is going on there?
We are always going to do
can appreciate.
Whether it's an adult, child, or an infant. If a choking victim becomes unresponsive, we're starting CPR. You can check the airway to see if you can see the object that's in their airway before you give a breath. And if you can see the object, you can remove it by doing a finger sweep. We are not supposed to do blind finger sweeps. So if you can see it, you can remove it. 20. Where should AED pads be placed on a child if the pads risk touching each other? A, side by side on the chest. B, on the stomach and leg. C, anterior, posterior, front and back. Or D, do not use the AED.
Fluid around here, but I can't see that. You can see the
revealing the correct response in 3, 2, and the answer is C. Yes. So placing one pad on the center of the chest and one pad on the center of the back ensures the correct the current passes through the heart without the pads touching. And here's the illustration. So center front and center back.
It can only be managed after delivery.
Question 21. You are a lone rescuer or a single rescuer
so this is
finding an unresponsive infant who is not breathing.
So the fetal heart rate
collapse was not witnessed.
The heart
what
rate
should
looks fine.
You do? A, call 911 immediately. B, find an AED first. C, perform 2 minutes of CPR and then call 911. Or D, wait for help.
Prone to infections. So the only time that it can be managed is after delivery. That's when they can
revealing the correct response in 3, 2, and yes, it is C. So whenever you have an unwitnessed arrest of a child,
so
you perform 2 minutes of high quality CPR first
so don't make
to get blood flowing to the brain. So the care first principle applies here. Oxygenate the blood before leaving to call for help. If it's unwitnessed and it's a child, 2 minutes of CPR first, a child or an infant. 2 minutes of CPR first, and then go call 911. And that's assuming you don't have anyone there to call 911 for you, or that you don't have your cell phone readily available where you can just dial and put 911 on speakerphone.
Don't forget to share this educational
Question 22.
With your colleagues.
What is the correct hand placement for abdominal thrust, previously referred to as the Heimlich maneuver on an adult?
Other differential diagnosis
is it A, mid-abdomen, just above the navel?
In the comment section.
B, on the sternum?
Also,
C, below the navel? Or D, on the rib cage?
Any other dimensions or anything that you need to learn, kindly share with us. Thank you so much. Let's meet again in the next.
Yes, everyone answered it correctly. It is A, mid-abdomen, just above the navel. And so the rationale, the fist is placed against the abdomen, in the middle, slightly above the navel, and well below the breastbone. And you would do those upward thrusts. If you don't have anyone to assist you and you're choking and you're by yourself, you can put your abdomen against a chair, something that's sturdy enough to support your weight, like a table or even the edge of a sofa. And you would thrust your body into that object to help relieve or remove your own obstruction.
Cause challenges with
Question 23. When performing back mass ventilation, how do you determine if the ventilation is effective? A, the stomach rises visibly. B, you hear air escaping. C, the oxygen saturation reads 100%. Or D, visible chest rise.
That's the heart there, that's the face of the baby, that's the face of the baby, that's the chin of the baby. You can see the heart.
You are such a wonderful caregiver. Yes, the answer is D.
This is
seeing the chest rise with each breath is the primary confirmation for effective tidal volume. And that's about half the squeeze of the of the back mass device. So half squeeze should result in visible chest rise. If you see the stomach rise and fall, that means that you are giving too much breath, and as a result, your patient could vomit.
We check for the nasal
24. Which of the following team roles is responsible for recording the time of interventions and medication administration? Is it A, team leader, B, timer recorder, C, compressor, or D, airway?
So this baby is very active. So there's no free fluid Look at the eyes. Look at the mouth there. The eyes there. The mouth there.
The correct response is B, the timer/recorder. And so this designated role tracks time intervals such as switches, and also what medications are administered, and it records events such as when the shocks are administered.
So what I wanted to demonstrate
25. What is the maximum interruption time allowed for chest compressions during things like pulse checks or AED analysis? Is it A, 30 seconds, B, 5 seconds, C, 10 seconds, or D, 1 minute?
So this is the ductus venosus. So this is the ductus venosus there. Unfortunately, there's a reversal of the A wave there. So that's an abnormal ductus venosus waveform. So
if you chose C, you're absolutely correct. The goal is to keep the chest compression fraction or CCF high, which means that interruption should be limited to less than 10 seconds.
Presentation.
Question 26. What is the correct rescue breathing rate for a child or infant with a pulse? Is it A, 1 breath every 6 seconds? B, 1 breath every 10 seconds.
This baby,
C, continuous breaths.
The anatomy looks
or
fine.
D, 1 breath every 2 to 3 seconds.
The amniotic fluid is fine. So if you zoom it, you can
I see a lot of answers in the chat.
The fingers nicely. This is just...
If you selected D, you are correct. You're going to give 1 breath every 2 to 3 seconds because children have faster metabolic rates and require 20 to 30 breaths per minute. And the way I like to think of it is who breathes the fastest?
So you must localize
the breathes the fastest. So for an infant, if you are allowed to, based upon your protocol in your hospital, it would be 1 breath every 2 seconds. But let's say you have a school ager, you have a child who's a little bit older. Well, that would be the person you give a breath 1 every 3 seconds. But follow your medical director's guidelines.
That's the brain, fetal brains.
Question 27. You are using a bag mask device. Which technique is recommended for holding the mask in place as a single rescuer?
So
is it A, 2-hand palm technique,
just get pregnant,
B, C clamp technique, also referred to as EC clamp, C, O clamp, or O grip, and then D, press down hard on the nose.
So the mass effect of the baby when it's growing.
What is the correct technique when you are holding the bag mask device, the mask portion in place?
It now creates the problems.
That is right. It is B, the EC clamp technique. The thumb and index finger form a C on the mask, and the remaining fingers form an E on the jaw.
The data, if they can be removed.
Question 28. If a victim has a pacemaker, a visible lump with a scar on the chest, where should you place the AED pads? A, directly over the pacemaker. B, only on the back. C, do not use the AED. Or D, at least 1 inch away from the pacemaker.
It's going to come nice without any other major complications. So, ladies and gentlemen, I thank you so much.
If you chose D, you're absolutely correct. You're going to avoid placing pads directly over the device. You're going to remove the pad slightly to one side of the device or below it.
And you also
Question 29. Why is hyperventilation, giving too many breaths, harmful during CPR? A, it increases intrathoracic pressure, thus decreasing venous return to the heart. B, it increases oxygen too much. C, it causes the lungs to burst. Or D, it wakes the patient up.
Then I will go to the quiz questions, 10 quiz questions, where you are supposed to choose the
Why do we want to avoid hyperventilation?
Then after,
that's right, it is A. High pressure in the chest collapses the veins, returning blood to the heart, thus reducing the effectiveness of compressions. So too much of a good thing becomes a bad thing.
So now,
30. What is the first step in using an AED? Is it A, applying the pads, B, plugging the connector, C, power on the AED, or D, shout clear?
Within the uterus. So the yolk sac is the first structure. seen inside the gestational sac between 5 to 6 weeks. Sorry.
No, it's not D,
So
everybody. It is
sign
C.
is the
You're
bright
going to
echogenic
power
ring
on the
surrounding the
AED.
sac. So
And
this
some
is
of them,
what
as
we
soon as you
call
open up the case,
decidual,
it automatically starts
reaction that
talking to
we
you.
see.
So
It
you have
confirms
to know
pregnancy,
how to
and
use
this
the
is yolk sac
AED
that
at
you are
your
seeing there. That's the
location.
yolk sac
It's usually as
that we
simple
have
as
there.
1, 2, 3.
So
And they are so
that's the
user-friendly
uterus. So
until
the
if it
gestational
does have an
sac
on
there,
button,
that is
it's
the
green,
gestational
which
sac. So
means
this is
go.
the
So it's
gestational
time to
sac
go.
that we
We
have
have
there.
to save
That's
this
the
patient's
gestational sac.
life. So
And then
turning
the
on
yolk
the
sac there.
AED activates the
So the
voice
next
prompts
step, yolk
that
sac
guide you through
appears
the
at
rest.
5 to 6 weeks.
31. In a team setting,
Then
what
the
should you do if you
confirmation
notice the
presence of a gestational
compressor
sac
is not
confirms
allowing
an
full chest
intrauterine
recoil?
pregnancy. So the
A,
normal
wait
size
until the
gestational
neck
sac
switch
2
to
to
tell
3
them.
millimeters,
B,
visible
push them out of the
84
way.
and a half weeks.
C,
So
constructively
it's on the
correct them
calendar. It
immediately.
can be noted
D,
from
ignore it.
4.5 to 5.5 weeks. So this is the decidual reaction that
Your
you're talking
team
about.
members
So the gestational sac.
not performing
So
CPR correctly,
our
they're not allowing full chest
quiz
recoil.
sessions are going to be derived
What do you
from the
do?
first trimester.
That's
So your
right. We're going to
understanding
continue
of
working
the
together as
signs
a
of an
team.
early
You're not going to push them out of the
pregnancy
way. That's
are
rude.
fundamental
It's
or
going to be
key
C.
for you to
Effective team
answer the
dynamics
questions
require
which are following.
constructive intervention to ensure
So let's go
high-quality
to question number
CPR.
1.
And the
Which
American
structure is
Heart
the first to be
Association has
seen
a
within
role
the
that is
gestational
referred
sac?
to as the CPR coach.
A,
And the CPR
embryo.
coach would be the person
B,
who is monitoring the
amniotic
quality
sac.
of the CPR.
C,
And if you don't
the yolk
have that
sac.
person, it is
D,
expected that
the
during
placenta.
CPR, that
So which
someone
structure is the
is
first
going
to
to
be
be
seen
monitoring the
within the
quality so
gestational
that we
sac?
can make sure that we are
Embryo,
doing our best
the amniotic
efforts to
sac,
save this
the
patient's
yolk
life.
sac, or the placenta. So
32.
write the answer
What is
in
the
the comment
correct
section.
depth
Then
of
let's
compressions
discuss.
for an infant?
Then after,
Is it A,
I'm
2
going to give you
inches,
the answers.
B, 0.5 inches, C,
Question number
until you
2.
feel
At
resistance,
approximately
or
what
D,
mean gestational sac
approximately
diameter
1.5 inches?
should an embryo normally be visible on transvaginal ultrasound? A, 10 millimeter. B,
Revealing the correct
15
response in
millimeters.
3, 2,
C,
and
25
it
millimeters.
is
Then
D.
D,
1.5
35
inches
millimeters.
or
Why?
approximately
Which one is the correct
1/3 the
response? At
chest depth
approximately what
is the
gestational
specific depth
sac
for
diameter?
infants.
MSD. Should an
33.
embryo
You are
normally be
performing
visible
CPR on a victim who
transvaginal
has been
ultrasound?
submerged in
A,
water.
10
What should you
millimeters.
do
B,
before
15
applying
millimeters.
AED
C,
pads?
25 millimeters.
A,
Then D,
remove the victim's
35
wet
millimeters.
clothes completely.
Question
B,
number 3.
dry the victim's chest.
A crown
C,
rumble
no
length
special
measures 8
attention is
millimeters,
needed.
but no
D,
cardiac
wait
activity is
for the
seen.
victim to
What is the
dry
most likely diagnosis? A,
naturally.
normal early pregnancy. B, means miscarriage, early pregnancy loss. C, pregnancy of unknown location. D,
The answer is B,
the molar
dry the
pregnancy.
victim's chest.
A
And so the
crown
American Heart
rumble length
Association,
measures
according to their
8 millimeters,
2025
but
guidelines
no
update,
cardiac activity is
they
seen.
have
What is
recognized
the
that due
most
to
likely
cultural
diagnosis?
differences,
A,
some
normal early
rescuers may feel
pregnancy.
uncomfortable touching a
B,
woman's
means
chest, exposing a
miscarriage,
woman's chest, etc. And so
early
what that
pregnancy
means is
loss.
that research has indicated that
C,
women are
pregnancy
less
of unknown
likely to
location.
survive
D,
cardiac arrest events that
molar
happen
pregnancy.
outside of a hospital because of the chest
Question number
factor.
4. Which ultrasound
Male
finding
rescuers, if you feel
Which ultrasound
uncomfortable
finding
touching the
is
chest,
most
exposing the
suggestive of
chest,
an ectopic
keep
pregnancy?
doing those high
A,
quality chest
intrauterine
compressions.
gestational
If there's
sac
a
with
woman
yolk sac.
nearby or someone who
B,
feels comfortable exposing
adnexal
the chest
gestational
and
sac
drawing the
containing
chest,
a yolk sac or
please
embryo.
allow them to take
C,
over and do so.
thickened endometrium.
So American Heart
D, a
Association
corpus
has their
luteum cyst.
guidelines, but as
Which
a basic
ultrasound
life
finding is
support
most suggestive
provider,
of an
my
ectopic
expectation of
pregnancy?
you is that you're
A,
going to do everything to save
intrauterine
that woman's
gestational
life.
sac with a yolk
Of course,
sac.
you have 911 on the phone. They're going to ask if you have an AED,
B,
and if you have
adnexal
one,
gestational sac
use it
containing a
because
yolk sac
women
or
are more
embryo.
likely to die from sudden cardiac
C,
arrest
thickened
if it
endometrium.
happens outside of
D,
a hospital
corpus luteum cyst.
because of the breast factor. Okay, so let's get over that.
Question number
We
5.
want you to do
Which
everything to save a
measurement
woman's
provides the
life
most
the
accurate
same way
estimate
you'd
of
save
gestational
a
age
man's life.
during the first trimester? Which measurement
Question
provides the most accurate
34.
estimate of gestational
According to the
age
2025
during the first
guidelines,
trimester?
how
A,
should
the
you
biparietal
position your
diameter.
hands
B,
for
the
adult
femoral length.
chest
C,
compressions?
the crown rumble
A,
length.
2 hands
D,
centered
head
on the
circumference.
upper half of the
Which
sternum.
measurement provides the most
B,
accurate
on the
estimate of
left side of
gestational
the
age
chest.
during the first trimester?
C,
A,
over the xiphoid
biparietal
process.
diameter. B,
D, 2
femoral
hands
length. C,
centered on the
crown rumble
lower
length.
half of the
D,
sternum.
head circumference. Question number 6.
And we're going all the way to question
Increased
50.
knockout translucency is associated with
The answer is
conditions.
D.
A,
So we're going to avoid
placenta
the
previa.
upper half of the sternum. It's going going to be the lower half.
Down
This
syndrome
position
trisomy 21.
places the force directly
C,
over the ventricles or the bottom
polyhydramnios.
part of the heart
Then
for
D,
maximum cardiac output.
oligohydramnios.
35. A victim becomes unresponsive while you are performing abdominal thrust for choking. What is your first action? A, check for a pulse. B, continue abdominal thrust. C, begin chest compressions. D, open the airway and look for the object.
Question number 7. Which ultrasound sign is classically associated with the molar pregnancy?
The answer is C. If a choking victim goes unconscious, lower them to the ground and start CPR immediately. Do not check for a pulse.
Banana sign. D.
Question 36. When should you deliver a shock from the AED?
Which ultrasound sign is
A, immediately upon arrival. B, if the victim has no pulse, regardless of the AED prompt.
B,
C, only when the AED prompts shock advised. D, after 5 cycles of CPR, regardless of analysis.
Let's talk, let's discuss. Please attempt, that's the way to learning. Learning is not about you.
That is right. It is C. You cannot deliver a shock unless the machine, the AED, identifies a shockable rhythm, such as VFib, which would be VF, or pulseless VTAC, and charges.
In the first trimester?
So the shock would not be automatic. It will let you know that a shock is advised. It'll let you know that it's charging. And then you as the rescuer would have to press the button that delivers the charge.
Number 8.
And of course, before you press that button, the word that you're going to shout out would be clear. Make sure that no one is touching the victim, including yourself, because that way it keeps everyone safe and it prevents someone who has a normal perfusing pulse from getting shocked and their heart now changing into a non-perfusing rhythm.
Question number 9.
37. Which cardiac arrest rhythm is non-shockable?
Doppler? Which condition?
Is it A, asystole, B, ventricular fibrillation, C, ventricular tachycardia pulseless, or D, atrial fibrillation?
Uterine fibroid.
And I know those are some big terms, but I already told you this answer. So I know you're going to get it right.
Doppler, A.
Which cardiac arrest rhythm is non-shockable?
C, endometrial polyp. D.
That's right, the flat line. Okay, D is not a cardiac arrest rhythm. D, atrial fibrillation would be a perfusing rhythm. So we're not going to shock a perfusing rhythm unless it's like super fast or super slow. So for this one, the correct response is going to be A.
Which structure develops into the fetal
asystole or flat line represents no electrical activity. Shocking, it does nothing. CPR is the treatment.
Decidual basalis.
38. How do you perform chest thrust on a responsive infant with a severe airway obstruction? A, with the heel of one hand in the center of the chest. B, using both thumbs. C, you should use abdominal thrust instead. D, with 2 fingers just below the nipple line.
Or the amnion. So, ladies and gentlemen, these are our 10 quiz questions.
And this one reflects the 2025 American Heart Association Guidelines Update. The answer is not D.
Then we discuss.
The answer is A. With the heel of one hand in the center of the chest. Remember, we're not using the 2 fingers anymore on infants. Infants with severe foreign body airway obstruction, you'll do repeated cycles of 5 back blows. So back blows first, and then alternate with 5 chest thrusts. We don't perform abdominal thrusts, and we're no longer using the 2-finger technique on infants because it was not deemed to be
all the best in the quiz session. Enjoy
39.
The rest of your day.
What is the best way to open the airway of a victim with no suspected neck injury?
So that they also attempt.
A is jaw thrust. B is head tilt only. C is chin lift only. D is head tilt followed by chin lift.
Hello and welcome back. So
yes, the answer is D. This maneuvers the tongue away from the back of the throat.
Obstetrics quiz 1. So I will discuss and give the explanations.
Question 40.
Thank you to all those who...
In a 2 rescuer CPR, what is the role of the second rescuer while the first is doing compressions?
Well done on that.
A, check the pulse continually. B, maintain the airway and provide ventilation.
Number 1.
C, rest. D, monitor the feed.
Which is the first to be seen within the gestational sac? A, the embryo. B, the amniotic sac.
If you selected
C,
B, you're
the yolk
absolutely
sac.
correct.
D, the
The
placenta.
second rescuer manages
Which
the
structure is the first to be seen
head/airway
within the gestational
and
sac?
delivers
So our
breaths
correct
during the
answer is C, which
pauses.
is the yolk sac. Explanation: the yolk sac is the first anatomical structure visible inside the
Question
gestational sac and
41. Which of the
confirms
following
an
indicates a victim has a severe
intrauterine
airway
pregnancy.
obstruction? A, they can
So
speak and cough
it is the
forcefully.
one that we
B,
use
they are wheezing
to
loudly.
identify that this
C,
is
they
indeed
cannot
an
speak,
intrauterine
breathe, or
pregnancy
cough
in the first
effectively.
trimester and
D, they
differentiated
are
from
crying.
pseudo-pregnancies or pseudo-gestational
I'm
sex
going to give you about 3
that can
seconds to
also
enter your responses in the chat.
present.
And you
So the question
have
number
it, it
2,
is C.
at
So
approximately
silent
what
cough,
gestational
inability to
sac
speak, and
diameter MSD
cyanosis
should
or
an embryo
turning
normally
blue
be
are
visible on
signs of severe
transvaginal
obstruction
ultrasound?
requiring immediate
A,
intervention.
10 millimeters. B,
42. When checking for
15
breathing,
millimeters.
what are you
C,
looking for?
25
A,
millimeters.
pulse rate.
D,
B,
25
eye
millimeters.
movement.
Then
C, chest rise and fall. Or D, skin
our
color.
answer is C, 25 millimeters. At approximately what mean gestational sac diameter should an embryo normally
Yes,
be
when you're
visible on
checking for
ultrasound?
breathing,
So we
you are
use
looking for C, chest rise and fall.
25 millimeters.
You're going to scan the chest
threshold
for 5 to 10
where if we
seconds.
see a gestational sac that is above
43.
2.5 millimeters,
What is an
centimeters
agonal
without
breath?
a gestational,
Is it
without
A,
an embryo,
infrequent
we
gasping
then
breaths?
suspect a blighted ovum
B, rapid deep
or
breathing?
an
C,
embryonic
whistling
pregnancy.
sounds? Or D,
So if you see
normal
that
sleep breathing?
there's no fetal pole, yet the pregnancy, the gestational sac is still below 25 millimeters.
I
in
see
vivid
we're
time. We
torn
don't
with our
rush to say
responses
this is
in
a
the
blighted
chat.
ovum.
So agonal breathing
So
would be
explanation
A.
in MSD of
Agonal gasps
which is
are
greater than or
a
equal to 25
sign of
millimeters
cardiac
without
arrest
an embryo
and
is
should not be
diagnostic of
confused
pregnancy
with
failure
normal
on
breathing.
transvaginal
You're
ultrasound.
going to start
So it
CPR.
will be an
So you go in,
indicator
you tap
of
and you shout, you're tapping on your
blighted
patient's or your
ovum.
resident's shoulders. There's no response.
So
Immediately
question
call
number
for help.
3,
Press the cold button,
a
scream
crown
for the
rump
nurse.
length measures
And
8
now for the
millimeters,
next
but
10
no cardiac
seconds,
activity
5
is
if you're a
seen.
more
What is
experienced
the most
healthcare
likely
worker,
diagnosis?
but 10 if
A
you're a little
crown
novice or
rump
new.
length
You're
measures
going to put
8
2 fingers on the
millimeters,
carotid pulse on the side
but no
nearest
cardiac
you.
activity is seen.
You're
What
going to
is
be
the most
feeling
likely
for the
diagnosis?
pulse
A,
while
normal
simultaneously
early
watching for
pregnancy.
chest rise and
B,
fall.
missed
You do not
miscarriage
feel the
early
pulse,
pregnancy
but your
loss.
patient lets out a
C, pregnancy of unknown
gasp.
location. D,
No
a
more
molar
breaths,
pregnancy.
no other signs of life.
A crown
That
rump
is a
length
precursor
measures
of
8
cardiac
millimeters, but
arrest.
no cardiac activity
You
is
scream
seen.
for that
What is the
AED
most likely
and you
diagnosis?
start
A,
doing your
normal early
compressions.
pregnancy.
So again, agonal
B,
gasp or
missed
agonal breathing,
miscarriage
person
early
letting out
pregnancy
their
loss.
last bit of
C,
air, that would
pregnancy
be a
of unknown
sign of
location.
cardiac arrest,
D,
and you should
molar
not
pregnancy.
confuse that with normal breathing.
So
Remember,
our
there was
correct
no
answer
signs
is
of life
D,
and you did
which is a
not
missed
feel a
miscarriage.
pulse.
Explanation:
44.
absence
For a
of cardiac
child victim,
activity in
if
an
you do not
embryo
have
with crown rump
pediatric
length
AED
above 7
pads,
millimeters is
what should you
diagnostic
do?
of an early
A, do not
pregnancy
use the
loss.
AED. B, cut the adult
Okay,
pads in half.
so
C,
let's
perform
go to
only
the
breaths.
question
Or
number 4.
D, use adult pads.
Which ultrasound finding is most suggestive of an ectopic pregnancy?
Yeah, this one's tricky.
Which
I
ultrasound finding is
agree.
most suggestive of an ectopic pregnancy?
But it's
An
not tricky for you
intrauterine
all. We're
gestational
going to
sac
use
with
the
a
adult
yolk
pads. The
sac.
answer is D. The rationale.
Adnexial
It's better to use
gestational
adult
sac containing
pads,
a
which
yolk
will
sac or
deliver a
embryo.
higher shock
C,
than no shock at all.
thickened endometrium.
And whenever we
D,
are,
corpus
thinking that
luteum
those pads
cyst.
are going to touch,
Which ultrasound
we don't
finding
use the
is
pad
most
placement that's
suggestive
on the
of an ectopic
pads.
pregnancy?
Instead, we're going to put one pad
So
in
the
the
correct
front of the
answer is
chest
D.
and then one pad in the center of the back, as
Adnexial
illustrated in the
gestational sac
image
containing a
there.
yolk sac
And that prevents the
or
pads from
an
touching.
embryo.
You can use an adult AED
Explanation: a
on
true
all
gestational sac
ages, adults,
with a
children,
yolk
and
sac
infants.
or
However, you
embryo
cannot use
located
a
outside the
pediatric
uterus
AED or the
confirms
pediatric
an
pads
ectopic
on an
pregnancy.
adult. If you don't have adult
A true
pads,
gestational
or
sac
if you
with a
don't
yolk
have the
sac or
AED,
embryo located
remember
outside
what
the
we're going to
uterus
keep
confirms a
doing. We're
gestation
going to keep
in
focusing on
a
CAB.
ectopic pregnancy.
We're going
So
back to those
if
compressions
you are
and
going to see
focusing
an
on
extrauterine
circulation.
pregnancy, then you have
45.
been confirmed
Closed
that
loop
it's
communication involves
an
A,
ectopic
shouting
pregnancy. So
orders
what you're supposed
loudly.
to do is you're
B,
supposed to
repeating the
check the
order
uterus
back
first.
to the team
Don't just
leader. C,
comment to
using
say that
hand
everything is
signals.
extrauterine
Or
before
D,
you see
only
the
the
alignment
lead
of the uterus, or
speaking.
before you
Or
check
only the
if there are
leader
no other
speaking.
congenital anomalies of the uterus like diadeps uterus, bicular
Closed
uterus,
loop
septic uterus.
communication.
So those should guide you before you
Yep, you got it. We're going to repeat those orders back. Now, look at this team, and it's a rescue team, and they're trying to save a life. And now it could get really loud. It can be chaotic. There could be 10 people in the room. I need to know you're speaking to me. So you're going to point to me. If you can't see my badge because maybe I have on PPE, you're going to point to me and you're going to say, hey, you, because you may not know my name, you are going to do the first round of compressions. And I'm going to repeat it back to you. I have the first round of compressions. So the receiver repeats the order to confirm it was heard and understood correctly. That is how we close the communication loop. 46. Which link in the chain of survival is the most critical for survival from ventricular fibrillation? Is it A, advanced life support, B, post-cardiac arrest care, C, rapid defibrillation, or D, recovery?
B, Down
and I know we discussed a lot, but I told you this in our review section.
Oligohydramnios.
What do we do for VFib?
NT, which is the knockout translucency.
I see you changing your answers. Yes, for VFib, we defib. So the answer is C, rapid defibrillation. Defibrillation is the only effective treatment for ventricular fibrillation. Time to shock is the biggest predictor of survival. So we need to get that AED on the scene and on that patient as quickly as possible.
Especially Down syndrome and some
47. How deep should chest compressions be for an adult? You know this. We've already talked about it.
Now,
is it A, B, C,
which
or
ultrasound
D?
sign is classically associated with molar pregnancy? Which ultrasound sign?
I know I put centimeters first.
Associated with molar pregnancy? A.
And yes, if you chose B, you are right. At least 5 centimeters or 2 inches up to 2.4 inches. That is the standard adult depth for chest compressions. 48. What is the ratio of back blows to abdominal thrust in the 2025 adult choking protocol? Is it 3 to 1, 5 to 5, 15 to 2, or no back blows, only thrust?
Explanation incomplete. Identity more.
So A, B, C, or D.
With numerous cystic spaces, the so-called honeycomb appearance.
That's right. It is B, 5 to 5.
That is the
5 back blows followed by 5 abdominal thrusts.
Pregnancy.
49. You're responding to a pregnant woman in cardiac arrest. An AED becomes available. What is the correct course of action regarding the use of the AED? A, do not use the AED as the shock will harm the fetus. B, wait for the advanced life support ALS team to arrive before defibrillating. C, use the AED but reduce the energy dose by half. D, use the AED immediately and follow standard steps.
Detection of the fetal cardiac activity is the first definitive sign of a viable intrauterine pregnancy. So it's if there is no heart,
the answer to 49 will be revealed in 3, 2, and the answer is D. Use the AED immediately and follow the steps of the AED.
Question number 9.
Here's a rationale. The best way to save the baby is to save the mother. Defibrillation is safe and effective in pregnancy. The best hope for fetal survival is maternal survival. Use the AED as you would for any adult cardiac arrest victim. 50. If you are too tired to continue high-quality CPR and no one else is available, what happens? A, stop immediately. B, continue at a slower rate. C, the AED will take over compressions. Or D, the patient's chance of survival drops significantly.
Not ectopic pregnancy can also show this sign, so it is not specific. So you have to take that down. That
you're getting tired. You're by yourself. No one has come yet. What's going to happen?
So it's not specific.
Well, the answer is D.
The major difference is
the chance of survival is going to drop significantly. This is the reality. You're going to get tired. Okay, you're going to become fatigued. That is why as soon as you find someone who's unresponsive, somebody who doesn't have a pulse, they're not breathing, you're calling for help immediately. The person who comes to assist you, let's say you're in a home care setting, the person who assists you doesn't have to be certified in CPR. It would be nice if they were, but they can open the door, they can, call 911. If they're strong enough, they could even take over the chest compressions to give you a moment to get a break. Remember, this is a team effort, and so you can only do so much by yourself. So you're going to be calling or activating EMS as soon as you can, and you're also going to utilize any bystanders who are in the area who can assist you. And guess what, team? I am so proud of you. You have completed a full 50-question CPR/BLS review and practice test. If you are interested in becoming an instructor, if you want to learn more about the classes we offer at Florida Training Academy, go ahead and scan the QR code that's on the screen. And then if you want to support us further, don't forget that, yes, I'm an author. And so I have a new CNA exam prep study guide, which can be purchased directly on our website or on Amazon by scanning the QR code that you see there. Thank you for watching. It has been a pleasure helping you review and prepare for your basic life support class. And if there's anything we can do for you at Florida Training Academy, don't hesitate to reach out. We appreciate you. We wish you much success on your career endeavors. Have a great day. Final reminder before the practice test. Whenever you're performing CPR, you focus on high quality CPR. That means compressing deep, compressing fast. Remember, we're compressing at least 100 to 120 beats per minute. And then as far as your depth, it is going to be 2 to 2.4 inches for adults, 2 inches for children, and 1.5 inches for infants. You also have to know your ratios and terminology. If you're
from the first moment I saw you,
it's 30 compressions to 2 breaths. For children
I knew I had
to
make you mine.
15 and 2. Use the current
wanted to know everything about you,
and then read questions carefully.
I didn't want to waste no time.
So the terms that we use, rock, AED,
what's something I can do for you, darling?
Those again in your actual class. Remember,
that would make you smile.
You're preparing to save lives.
I'll bring you flowers, girl.
Provider and instructor level courses.
Enough to see for miles.
If you'd like more information, you can go to our website, which is fltraining.com.
Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours.
Only until the object is expelled.
I love your style,
5 back blows, followed by 5 abdominal thrusts.
and I love to put a smile on your pretty little face.
Sleep followed by rescue breath.
I love it when you're close to me. That's where I want you to always be.
2 and 1.
I didn't know
According to the newest guidelines, the answer is B.
that I
5
would
back
find
blows, followed by 5
a
abdominal
love so
thrusts.
true.
For 2025,
And you can see it
now
in
recommend a
my
cycle of 5
eyes.
back blows,
That
followed by 5
girl,
abdominal thrusts
you've
for
got
adults
me
and children.
hypnotized. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure, girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure. Girl, my love is always yours. Something's changed, baby, this I know. Summer rains turn to winter snow, but I promise you for sure. Girl, my love is always yours.
Chest compressions. Question 2. You are performing high-quality CPR on an adult victim. What is the correct compression rate? Is it A, 100 to 120 compressions per minute, B, 80 to 100 compressions per minute, C, 120 to 140 compressions per minute, or D, as fast as possible? And this practice test has 50 questions, so you're going to be overly prepared for your basic life support examination. If you chose A, you're absolutely correct. The recommended compression rate for victims of all ages is 100 to 120 beats per minute to maximize cardiac output. Question 3, what is the correct compression depth for an adult victim? Is it A, approximately 3 inches, B, at least 1 inch, C, 1/3 the depth of the chest, or D, at least 2 inches, 5 centimeters, but no more than 2.4 inches, which is 6 centimeters? All right, and for this one, if you gave me one of 2 answers, I will take them. So I will accept C and D. All right, so for this one, I have D, but you can compress the chest 1/3 the depth. Here's the rationale for D, at least 2 inches, but no more than 2.4 inches. Compression depth must be deep enough to generate blood flow, but not so deep that it cause injury. So the standard is at least 2 inches or 5 centimeters. Question 4, when using an AED on a victim with a hairy chest, the pads fail to stick. What is the best immediate action? A, press down firmly on the pads and hold them during the shock. B, place the pads over the victim's clothes. C, use the razor in the AED kit to quickly shave the area. Or D, move the pads to the stomach. All right, revealing the answer in 3, 2, and yes, it is C. Great job. You're going to use the razor in the AED kit to quickly shave the area. Good contact is essential for analysis and shock delivery. Shaving the placement area ensures the pads adhere to the skin. And if it's taking you too long, you don't have a razor in your AED kit, continue chest compressions. When in doubt, go back to your chest compressions. Question 5. You find an unresponsive victim with no pulse and no breathing. After activating the emergency response system, what is your next action? Is it A, start chest compressions immediately, B, give 2 rescue breaths, C, check for a pulse again, or D, apply oxygen? Great job, team. You have the correct answer. Yes. When the victim has no pulse and no breathing, and you've already called 911, or you've activated that code button to get rapid response in the room, you're going to do A. You are starting chest compressions immediately. The CAB, compressions, airway, breathing sequence, prioritizes early compressions to circulate oxygenated blood. Question 6. What is the compression to ventilation ratio for a single rescuer performing CPR on a 5-year-old child? Is it A, 15 to 2, B, 10 to 1, C, continuous compressions without breaths, or D, 30 to 2? You have it. That is correct. The answer is D, 30 to 2. For a single rescuer, the ratio is always 30 to 2, regardless of the victim's age. That is, unless the victim has an advanced airway. And during your BLS class, your instructor will tell you about that. Question 7. Which of the following describes the correct hand placement for infant CPR, one rescuer? Is it A, 2 hands on the center of the chest? B, 2 fingers in the center of the chest just below the nipple line? C, 1 hand on the upper chest? Or D, 2 thumbs encircling the chest? I know this one's tricky because the AHA just changed the guidelines. So for this one, the answer is not B. The answer is D, 2 thumbs encircling the chest. According to the 2025 updates, the 2-finger technique has been eliminated because research showed it often fails to achieve adequate compression depth. While the heel of 1 hand technique is a valid alternative if you cannot physically encircle the infant, think of somebody who has arthritis. The hand placement must be on the center of the chest, not the upper half of the chest. And so 2-thumb encircling hand technique is the new way that you perform, whether it's single rescuer or 2 rescuer CPR. And here is an example. Question 8. When performing 2 rescuer CPR on an infant, what is the recommended compression to ventilation ratio? I know, how scary. Is it A, 30-2, B, 5-1, C, 15-2, or D, 50-2? That's right. I can't trick you. We've covered it. And yes, you have the correct answer. It is C, 15-2. When a single rescuer is available for children and infants, the ratio changes to 15-2 to provide more frequent ventilation. Great job, team. Question 9. How often should rescuers switch roles during CPR to prevent fatigue? Is it A, every 5 minutes? B, only when the compressor says they are tired? C, after every shock delivered by the AED? Or D, every 2 minutes or after 5 cycles of 30-2? I know, this one's tricky. This one's tricky. But yes, you have it. It is D. Every 2 minutes or after 5 cycles of 30-2. If you only switch after an AED delivers a shock, what if the person's in a systole and the AED never indicates that a shock is required? So that's why C is not the correct response. The correct response is D. Switching every 2 minutes ensures compressions remain high quality and the compressor does not become exhausted. Question 10. What is the maximum amount of time you should take to check for a pulse? Is it A, 5 seconds, B, 10 seconds, C, 30 seconds, or D, 15 seconds? Perfect. Yes, it is 10 seconds. So the answer is B. Pulse checks should be at least 10 seconds, but no more than, should be at least 5 seconds, but no more than 10 seconds to minimize interruptions in CPR. So for those people who are the rapid response team, those advanced rescuers, they can do a quick pulse check, 5 seconds, get back on the chest. But in your classes, we allow you up to 10 seconds because, again, this is basic life support. We have to give you an opportunity to learn what you're doing and to grow in your clinical and your critical thinking abilities. Question 11. In the 2025 guidelines, where does the administration of naloxone fit into the BLS sequence for a suspected opioid overdose? So in other words, when do we administer Narcan? Is it A, give naloxone before starting CPR? B, wait until EMS arrives to give naloxone? C, give naloxone as soon as it is available, but do not delay high quality CPR? Or D, do not give naloxone if the patient has no pulse. You have it. It is C. Give naloxone as soon as it is available. Do not delay high-quality CPR. Naloxone is crucial for opioid reversal, but it should not delay the start or continuation of chest compressions. Question 12. You witness a 9-year-old child collapse suddenly. You are alone. What is your first action? A, perform 2 minutes of CPR, then call 911. B, give 2 rescue breaths immediately. C, check for a pulse for 30 seconds. D, leave the child to activate the emergency response system and get an AED. The correct response is D. Leave the child to activate the emergency response system and to get an AED. For a witnessed sudden collapse, the cause is likely cardiac. Immediate defibrillation is the priority, so you should activate the system and get the AED first. .13. Which pulse site do you check
Hello,
for an
ladies and
infant?
gentlemen. So in this presentation, let's
Is it
talk
A,
about one of the
carotid,
details of fetal
B,
echocardiography.
brachial,
So,
C,
illusions are
radial,
everywhere.
or D, femoral?
The practice of medical ultrasound is not an exception. There are so many illusions which are attached to it.
And we'll give you about
And
3
many
seconds to
reports,
enter your
they are a
answers in the
product of
chat.
illusions. So I need you to appreciate and understand some of the
The
illusions
pulse
that
site
you
for
are
an
likely
infant
going
is going to be the
meet
brachial
or
pulse,
which
which
are
is
going to
located
challenge
on
you
the
when you do
inside of
your
the upper arm
echocardiography.
and is the standard
So
check
here
site for
again, we are
infants.
continuing with the
Remember
fetal
that
anatomy.
infants,
Can
their
you
heads
see
are larger than
here
their
what we
necks,
have
so it's going to
here?
be really
That is
hard for you to feel, to
stomach,
palpate a
upper body.
carotid
Then you
pulse
can
on
see
an
the umbilical
infant.
cord
Thus,
nicely there
we
on the
check the
fetus, and you can see
brachial
this is the
pulse
umbilical
instead.
artery waveform there, which is very normal.
14.
Then
What is the
that's a very
primary
normal
purpose of
low
allowing
resistance
complete
umbilical
chest
artery
recoil between
Doppler waveform that we
compressions?
have there.
A,
As you
to
can
allow
see
the
there.
heart to refill with
So if you
blood.
can look here, you can
B, to reduce
see
rib fractures.
again. This is
C, to
where the
verify the
cord is
patient is
attaching. That's
breathing.
where the cord is
D,
attaching.
to rest the
The fetal
rescuer's
cord is attaching there.
hands.
So let's look at the heart now. Look here at the sinus of Vasava there. It looks like there's a coarctation there. Look
If
at
you
it nicely.
selected A, you are
If you
absolutely
are not so
correct.
careful, you can
Incomplete
think
recoil
of a
prevents
structure
the
there.
heart chambers from
Look at it
refilling. So
nicely
that
there.
means
See the rest
always
of the
having your
aorta there.
hand
It
on the
looks
chest.
perfect. If you go
What you're
there,
going
it
to
looks like
hear
there's a
us
structure.
say in
Guys,
your BLS class
probe misangulations
is that
cause
you're going to
these
hover. So you're going to
artifacts, or
raise
it
your
can cause
hands
these
off the
illusions.
chest
So if you
whenever it's
put color
time
there,
for
you can see
rescuer
that the
number 2
aorta
to
is filling
administer their
nicely there.
breaths.
There
So
is
let me
no
repeat that
sonographic sign of
rationale.
coarctation. Look at it again.
Incomplete
So you
recoil
feel that
prevents the
there's a
heart's chambers from
coarctation there,
refilling,
which
significantly
doesn't
reducing the
exist.
blood
So look at
ejected
it
during the
again.
next
So look,
compression.
guys, there's
So you press down,
effusion
you allow the
there. So
chest
there's
to
a pericardial
fully
effusion.
recoil to
This
rise
is
back up.
physiological, guys, not
And then
pathological. This is a
also,
little bit
whenever
for
rescuer number 2 is giving
just for
breaths, you
lubrication.
take your
Look at these
hands off
valves.
the chest
Look
altogether.
here at the root,
Question
aortic root there.
15.
It looks like there's a coarctation.
You are
So if you're
providing
not
rescue
careful,
breathing
guys,
for
you're
an
going to
adult with
report
a pulse.
a case of a coarctation of the
What
aorta,
is the correct rate?
which in practical
Is it A,
does
1
not
breath every
exist.
3
Look
seconds?
again here.
B, 1 breath every
Between the
10
right and the left ventricle, it
seconds?
looks like there's an
C,
opening
1
there.
breath
It
every
looks like
6
there's
seconds? Or
a
D,
venous
2
shunt
breaths
there,
every
a
5
venous shunt
seconds?
there. But there's no shunting, guys. It's just the probe
All right, let's
misangulation.
think
If
this
you
through.
change
We
the
have
angle,
an
you're going to see that this
adult
line is continuous. The
patient
septum is very
who's
continuous.
experiencing anaphylaxis.
Look
Their
again,
airway has
look again
closed.
here.
They have stopped
So
breathing.
everything looks perfect. Look
We're
at the face
trying
of
our
the baby. Look at
best
the
to
mouth
give
there
them
that's open. Look
breaths
at the eyes there, the nose. Look
using
at
a
the nose.
back mask
Look at
device.
so that view is very nice,
How
guys. Where you
frequently
see
do we give a breath?
the nose of the fetus, it's very excellent.
I know this one's tricky. So the answer is
exclude
C.
other pathologies.
The guideline recommends one breath every 6 seconds, or approximately 10 breaths per minute for adults in respiratory arrest.
I like that view so much.
And
I
so
like that
if
view
a patient is
where you
intubated or if
can
they have an
appreciate.
advanced airway and they're an adult, it's the
Let's have a
same
look again
exact
there. Let's have a
frequency.
look there
You
again.
give
Let's have a look
one
there.
breath every 6
And
seconds.
then
It's no longer a
you can
ratio
see
of 5 to
what
6
is going on
seconds.
again. So
16. When performing CPR on a pregnant woman, what modification is recommended if possible? A. Perform compressions on the back. B. Stop compressions and focus on ventilation. C. Manually displace the uterus to the patient's left side. D. Use abdominal thrust instead of chest compressions.
Most of the reports, about 60 to 70% of people that are doing fetal echocardiography, what they are writing are illusions. It's not only confined or isolated.
This would be so scary to have to. But according to the American Heart Association, if possible, you would do C.
At the apex of the heart,
you would manually displace the uterus, mom's stomach, to the left side. So left lateral uterine displacement relieves pressure on the inferior vena cava, thus improving blood return to
so it looks like there's
the heart during
there's
CPR.
an opening which doesn't exist.
If you are not an advanced provider, if you're not someone who has been trained to do so, you focus on those high quality chest compressions. And when the paramedics, when the ambulance comes, when the rapid response team comes, they are the ones who can displace the abdomen. So if you're afraid to do so, if you don't have enough rescuers, remember, chest compressions are more important if you're a single rescuer than you trying to manually displace the uterus.
Nicely, because those who did physics, they know the relative motion, the principle of relativity. So when two structures are in motion, it can also create artifacts. So you can see the nice 4-chamber view there.
Question 17.
Very nice.
An AED advises no shock advised.
Look at the eyes.
What is your next immediate step?
Upper lip, then lower lip.
A, check for a pulse. B, wait for the AED to reanalyze. C, give 2 rescue breaths. Or D, resume chest compressions immediately.
Heart rate of the baby or the fetus. So, ladies and gentlemen, what I need you to do is
an AED advises no shock advised. What do you do?
The do's and the don'ts of ultrasound. If you know the do's and don'ts,
you're going to do D. You're going to resume those chest compressions because the AED has already analyzed the heart, which is why it said no shock.
Don't follow the rules and protocols, and if you are not informed, you are going to fall into
have to go back and do a pulse check after the AED has done its analysis.
Due diligence when you are
no shock advised.
Doing
if no shock is advised, the rhythm is likely asystole. Remember that flat line that cannot be treated with energy? Or it is PEA, which is pulseless electrical activity. That means that the heart still has electrical activity, but maybe there's something else going wrong, such as the patient has fluid built up around their heart, or maybe they are a victim of some type of traumatic event where there was substantial blood loss. And while the heart is pumping, there's nothing
look here, the baby is
flowing through the heart because they've lost so much blood.
The baby is moving, there's motion.
And say no shock advised. It's because maybe this person has a perfusing rhythm. Remember, your baby